diverse urban Native communities in the U.S. Illinois is also the territory of Ho-Chunk, Miami, Inagua, Menominee, Sauk, Fox, and their descendants. By making a land acknowledgement, we recognize that Indigenous peoples are the traditional stewards of the land that we now occupy, living here long before Chicago was a city and still thriving here today. As we work, live, and play on these territories, we must ask what we can do to right the historic wrongs of colonization and state violence and support Indigenous communities' struggles for self-determination and sovereignty. And I have put the link for that land acknowledgement, which is put up actually by Cynthia and her center. I put that link up on the chat box. So again, for those who don't know me, I am Teresa Cordova. I am director of the Great Cities Institute at the University of Illinois at Chicago. This is an event co-sponsored by the Great Cities Institute with the Center for Global Health. And shortly I will be introducing Janet Lynn, who will introduce our keynote speaker. We have muted our participants upon entering, and your video is optional. We liked it because then we're able to see our audience. We'll have a Q&A session towards the end of the panel discussion. And there are two ways to ask a question. You can verbally ask a question, you can use your please raise hand button, or you can put it in the chat as well. So we'll be, you can look on the chat and those instructions are there as well. So again, welcome to this forum on climate justice meets global health in the time of COVID-19. We are, as we all well know, in very difficult and tough times. We thought it was important to have this conversation at this very important time as we look at some of the bigger forces and the bigger context for what is happening. So with that, again, you're obviously here because you see that we have such a wonderful array of panelists. I'm going to turn it over to Janet Lynn. Janet is an emergency physician, emergency medicine physician. She is with the Center for Global Health. She will tell you a bit more about herself, and she will introduce our keynote speaker, who will kick us off here today. So Janet, let me turn it to you.
Great. Can you all hear me?
You can.
Okay, great. My name is Janet Lynn. As Teresa said, I am an emergency physician by training. I am on faculty here at the School of Public Health as well as the College of Medicine and part of the Center for Global Health. And I wanted to introduce this topic because several of us had actually started this conversation about a year ago, really related to this intersection between what we would call disaster risk reduction, which is focusing on kind of the public health aspects of disaster response and how can we actually recognize existing vulnerabilities and identify strategies in which we can, one, do something about it, but two, engage the community and the larger population in regards to potential solutions as well as awareness. And then really with the conversation with the Great Cities Institute and Teresa, really thinking about what other components, what kind of intersection is there with other disciplines as well as industry where there is some overlap. And more specifically with this, it was more about focusing on climate and climate justice, the impact of the environment as well as industry, and how does that actually play into health and also healthcare. And so we had originally planned for really kind of a symposium that was focusing on climate justice and where and how it actually intersects with global health. However, I think as we have been in the midst of a global pandemic, it became very apparent to us that this is a salient conversation to have in respect to the response to COVID-19 as well. I think there's going to be a lot of rich discussion in relation to this. So this really is, as Teresa said, it's climate justice meets global health in the time of COVID. And so I really wanted to, we have a wonderful panel, I think, today. Jonathan Patz is our keynote and will hopefully be setting the stage as to the type of conversation and the topics that we will be talking about. I did want to introduce Jonathan First, I did meet him about almost a little under a year ago, and we really interacted really mostly on the global health front. There is the Consortium for Universities for Global Health, and specifically a Midwest Universities for Global Health session that we've been a part of for the past several years, and really learning about what he's done in his work really, I think, was exciting for me to secure Jonathan as our keynote to kick off this session. So Jonathan Patz, he is the director of the Global Health Institute at the University of Wisconsin-Madison. He is a professor in the John P. Holton Chair in Health and the Environment, with appointments both in the Nelson Institute for Environmental Studies, as well as the Department of Population Health Sciences at Wisconsin. For 15 years, Patz has served as a lead author for the United Nations Intergovernmental Panel on Climate Change, or the IPCC, and this was the organization that shared the 2007 Nobel Peace Prize with Al Gore. He also co-chaired the Health Expert Panel of the U.S. National Assessment on Climate Change, and which was a report that was mandated by the U.S. Congress. So I would love to take this opportunity right now to introduce Jonathan Patz, and I know he has an extremely engaging keynote to kick us off. Jonathan.
Janet, thank you very much, and thanks for organizing this, and it's great to be able to do this. And we'll do that just a second here. So you should be able to see my screen, and I'm going to go into the slideshow here. Okay, so just holler if you don't see anything, but the title of my talk is Preventing the Next Pandemic by Addressing Inequities and the Environment. So thumbs up if you see it. It's good? Great, okay. By the way, this cover image is a little bit closer to home than I realized. This was from just 3 weeks ago. NBC aired a special documentary on land use change and emerging diseases, and this happened to be, they interviewed my former student, Amy Vitor, and looking at our deforestation and malaria study. I'll get to this one later, but anyway, I just, I was amazed when I saw that image and found out that it was about our study. So today I'm going to be looking at some of the proximate socio-ecological determinants of our current pandemic and how that led to the emergence of this novel coronavirus. Then move to upstream environmental factors that come from human incursion into and disruption of nature. And finally, talk about a planetary health framework to prevent the next pandemic and even more extensive human suffering. And by planetary health, it's really about its equity, its environment, and all the interconnections that we really need to take a broader look if we want to be successful at preventing the next pandemic. So let's start with the proximate socio-ecological determinants. And I want to just dive a little bit into the Chinese live market scene. This was actually a program the Chinese government several decades ago, after mass starvation across China, was trying to figure out a way for peasant farmers to make an income and have things to eat as well. And so they actually promoted the domestication of wildlife and calling wildlife a natural resource, which meant that then maybe you could grow it more and sell it. And so it was promoted mostly for the poor peasant farmers in China. And then when you couple that domestic wildlife farming industry to illegal wildlife trade, then you see all of these species in the wet markets, the live markets. And of course, I'll show some slides about that, but that's where we have this problem of the pathogens spilling over from one species to the next. Here is an image, a photo of breeding rats, actually, you know. So wildlife, but also some of these other types of animals that if you can breed them and make them fatter, this is something maybe you can survive off of this. And so this is, you know, adopted by the Chinese to provide income for the poor. So what you now have, of course, we all know about these Chinese wet markets, the live animal markets, and it's this combination of legal, government-sanctioned domestic wildlife, but also illegal wildlife trade. And you see, of course, when you stack these animals on top of each other, it's an unnatural environment, easy for spillover of pathogens. And I'll talk about spillover in about 3 slides from now. There's another image of the wet markets. Now, there's been a lot of discussion lately, especially in our administration, trying to lay blame on this pandemic. And there's been discussion about, you know, where did the virus come from? Now, keep in mind that bats are the natural reservoir for many of the coronaviruses, the SARS-like coronaviruses. So bats are the primary reservoir, animal reservoir. And so the question, or was this natural mutations and spillover from one species to another, you know, remixing? There was a study published in Nature recently that showed that the genetic mutations of this novel coronavirus, SARS-CoV-2, which has caused the pandemic, the COVID-19 pandemic, that there are complex mutations that are over my head because I'm not a molecular biologist, but there is very high certainty that this virus did not come from human engineering, as suggested by conspiracy theorists, and our current administration is questioning this. So there are studies in Nature and in Science that are very descriptive as showing how this would be expected in natural evolution in wildlife, and that this is not something at all that looks like it was manipulated from a laboratory. The closest relative to our current COVID-19, the virus causing the COVID-19 pandemic, is a coronavirus in pangolins. Pangolins are the most widely sold and now endangered species. And so, unfortunately, this beautiful little animal for which those scales they use for medicinal purposes, of which none whatsoever have been shown to be true, that you see, that's a picture of pangolins that are slaughtered and they're being sold, and the scales are chopped up. And so this is something, a very unfortunate situation. I heard people ask, maybe this is the pangolins' revenge, this pandemic. But anyway, this is our situation. We have illegal wildlife trading, we have the wet markets. And this is ground zero. This is it's actually a seafood market in Wuhan, China, selling wildlife and livestock along with fish. And that, you know, from international travel, this is just looking at 1 week of flights out of that area. With the international travel, you know, we know the rest of the story. And for the United States, in fact, the genetic markers on our current virus in the US shows that most of the introduction came from Europe rather than directly from China to the West Coast. Most of the infection in the United States looks like genetically it came from Europe. So I'll just pause for a second and just tell you that, so the wildlife trade in China is really an issue of poverty, and it stems out of poverty, and it was promoted to solve a crisis of poverty and hunger. And now it has partly led to this situation. But that's the front end. The back end of the story now is that a study out of Harvard University looked at compared the exposure of air pollution in the United States with mortality rates of COVID-19. And the maps here are showing, county level 17-year-long average of PM 2.5 concentration compared to, on the bottom, the number of COVID-19 deaths per million population. This study was extremely well conducted, controlling for population density, for economics, for all sorts of key confounding factors. And just published last month in the New England Journal of Medicine. Here is a quote from the abstract. The results showed we found that an increase of just 1 microgram per cubic meter of PM 2.5 is associated with 15% increase in COVID-19 death rate. That is unbelievable. That's pretty strong. So here at the back end of this pandemic is equity issues about exposure to air pollution. And of course, we know about the problem with comorbidities, hypertension, diabetes, more prevalent in African American risk factors there. So there's a whole nother equity story with that I'm not going to go into. I want to point out this very interesting study from Harvard looking at air pollution and risk of dying from COVID. So in short, there's an inequity both at the front end and the back end of this COVID-19 pandemic. Now I want to move into the environmental determinants, and I want to go upstream and talk about the risk from human incursion into and disruption of nature. And this, the title of this opinion piece, What the Coronavirus Pandemic Tells Us About Our Relationship with the Natural World, I thought it was just right on target because we all know that our population has been disrupting the Earth systems all over the place. We're now in what all of you, I'm sure, have heard of, the Anthropocene, where humans are affecting everything on the planet. And since the 1950s, you can see, accelerations of carbon dioxide emissions, the most prevalent, the most widespread greenhouse gas, deforestation, biodiversity loss, nitrogen pollution. So we are really ramping up the disruption, the disturbance of natural systems. Land use change is probably the biggest cause for disease emergence. It's a threat to conservation. It's a driver of climate change, deforestation. You reduce the carbon sink that's so important to absorb CO2. It's driving economic growth, but there's a cost. And you see diseases like malaria, Ebola, and now SARS-CoV-2 that's causing the COVID-19 pandemic. These maybe this last one I'll show you as far as habitat disruption, how that plays into this pandemic that we're experiencing right now. But this is really not news. We published this paper now 16 years ago talking about unhealthy landscapes and how if you disrupt an ecosystem and put it out of balance and you change biodiversity, there's a risk that pathogenic diseases will take off. So this is not news, but we have not really made a lot of progress in slowing down our disruption of nature. And for many of you in the veterinary sciences, you know that a majority of newly emerging diseases in humans come from animals, the zoonotic diseases. And that gel electrophoresis in the background shows, patterns in African bushmeat hunters. And they show that they're seeing some of these animal viruses, the DNA from these other non-human primates showing up in the human blood. So we know that there's a big interaction, and it's called spillover, when a pathogen, let's say it's a virus, goes from one animal into another animal. It's called spillover. There's also spill back, when human diseases go back into wildlife, as happens with humans that go visit the gorillas, the mountain gorillas, and the gorillas get infected by some of the human viruses. But let's talk about non-human animals to human spillover. And this slide this slide from my colleague, Dr. Raina Plowright, is such an important slide. And every time you see a blue lightning bolt, that is showing a time where you have spillover, that you get spillover into a human. And notice what has to line up. You know, at the top end here, the reservoir host distribution. So the animals carrying that virus, what is their distribution? And if you cut up a forest into fragments, you're going to be forcing those animals to move, and maybe their density will change. And maybe with that density change, they'll be transmitting that disease back and forth, and your pathogen prevalence will go up. And they may be shedding viruses more. And here, human exposure, imagine humans going into a jungle, cutting down rainforest, and you have that human animal exposure. So all of these things need to line up to have a spillover event, which is a rare event, but not rare enough, especially as we're disrupting natural systems. We're making these rare events much more frequent. And we have seen some of these, you know, how far does the spillover event go? Like a rabid animal that bites somebody, that's called a stage 2 infection. What about Ebola, when you have exchange from a non-human primate into a human, maybe a bushmeat hunter, I'm sorry, up here we go, that then transmits Ebola to somebody else. And it doesn't go very far, but you have human-to-human transmission. That's stage 3. Stage 4 is when you have more sustained human-to-human transmission. And you can see maybe COVID-19 is there, or COVID might even go higher until you get absolutely complete human-to-human transmission, as happened with HIV/AIDS, from chimpanzees infecting humans. And now this is a human disease, as was smallpox as well. So you can see how far these spillover events can go. And COVID may end up going into stage 5. So I wanted to just make sure you understood that concept of spillover, and you can see the relevance for today's pandemic that we're dealing with, that this came from animals. There are other ways that we are disrupting natural habitats that have led to disease emergence. We've conducted studies in the Amazon, and you can see the light green here is deforested area, and then you can add in paved roads and unpaved roads and fires, and see lots of habitat change in the Peruvian Amazon. I'm sorry, this is the Amazon, the full Amazon. We did a study in the Peruvian Amazon and asked the question, you know, is deforestation changing the rate of malaria? Because malaria was resurging in that region. And after controlling for human population density by looking at abandoned agricultural sites that were deforested but did not have a lot of people, we found that the biting rate of the dangerous mosquito, the species called Anopheles darlingi, the biting rate increased in deforested areas after controlling for human populations. This is from Dr. Amy Vitor, former student of mine, and that was the cover image of this presentation that I first showed you. It comes from this study. A former student afterwards, Sarah Olson, showed that for every 1 of deforestation, the incidence or new cases of malaria increased by 11%. So another case of land use change and disease emergence. So let's talk about climate change. I'll end with this because, of course, this conference is about climate justice. And we know these physical attributes of climate change: temperature rise, sea level rise, extremes of the water cycle, floods, which bring droughts, floods, and fires, cut across many different exposure pathways, be it direct heat waves to air pollution to infectious diseases. And each one of these pathways has many climate-sensitive outcomes, climate-sensitive diseases. And because I'm focusing my talk really on COVID-19, I'm only going to focus on the infectious diseases, the sensitive vector-borne and waterborne diseases. This from the David Suzuki Foundation with this caption, "Global warming's greatest threat may also be the smallest." And that's because that mosquito is a cold-blooded organism. So whatever the air temperature is around that cold-blooded insect, that's the body temperature of that mosquito. And if that mosquito is carrying malaria parasites, well, the development rate of that parasite in the mosquito is completely dictated by the temperature and will determine how many days it takes for infective sporozoites to be in the salivary glands of that mosquito. It's temperature dependent. Let's talk about a different biological cycle. This is a different mosquito vector. This is Aedes aegypti that carries viruses. And these mosquito-borne viruses, dengue fever being the most prevalent mosquito-borne virus in the world, this mosquito carries all three of these: yellow fever, dengue, and Zika. And it's interesting that right before Zika erupted in South America, South and Central America, there was a climatic phenomenon that we all know about nowadays, El Nino. And the El Nino of 2015 into 2016, that winter of 2015, was tied for the strongest El Nino in recent history, and even lasting longer than the El Nino of 1997. So a colleague of mine, I asked him to do the temperature measurements during that El Nino, and he found that temperatures were more than 2 standard deviations above a constructed 60-year average temperature across the country of Brazil and Colombia, those two countries. Well, a study showed that if you look at the ability of that mosquito, Aedes aegypti, to transmit virus, this is called vectorial capacity. You know, how suitable is it for that transmission to occur? This is a graph over 60 years, actually 65, 68 years, 69 years, showing that right at that time, right before Zika erupted, and there was also a huge dengue epidemic in South America, that the vectorial capacity, which is influenced by temperature, was its highest in that period. The other thing, recent laboratory studies showed that the predicted thermal minimum for Zika virus transmission is 5 degrees warmer than that of dengue fever. So I don't want to tell you that, you know, climate is everything and absolutely cause Zika's emergence. It's a complicated story like any infectious disease. International travel was most likely involved and part of the story. But did those unprecedented temperatures have something to do with Zika virus erupting as largely as it did during that period? And finally, I want to just talk about the planetary health framework and what we need to do to prevent the next pandemic, because we now know, we now vividly realize that our own health is inextricably linked to the health of ecosystems. And when we see changes after the recent Brazilian election, and you see comparing rates of deforestation from last year to this year, now we have to ask the question, at what risk are we doing this much more damage to the forest? And, another thing that's really important to recognize is that, we've changed the world now. I mean, the pandemic has shut down the global economy. And I know that all of you have seen these images of New Delhi, India, before the pandemic, and then after we shut down the global economy that's mostly driven by fossil fuels. What could be any clearer comparing today's air quality with business as usual? And remember that air pollution kills 7 million people every year, according to the World Health Organization. 7 million premature deaths every year. So looking at this picture and recalling the study, the Harvard study I showed you about the inequity of COVID mortality, and that just a little bit of fine particulate pollution increases your risk of dying, that, there is another story here, that we have this, we know that air pollution is dangerous, but now people are able to see that, gosh, January to February, and look over France and other parts of Europe last March 2019 and this March. Look at the difference in air quality. Look at the difference in last year and this year in the United States. And who would have imagined that these mega cities in India would all have good air quality? We know pollution kills. We know it's dangerous, but now we see this incredible cleaning of the environment and realizing how much a fossil fuel economy really is harming our health. And it's this time that I ask this question, do we really want to uncork the conventional fossil fuel economy? Or do we want to get to a clean energy economy where everyone prospers? It's a matter of equity. And in this age of climate change, according to this IPCC report that came after the Paris Agreement, the United Nations was asked, what would it take to limit warming of the Earth by just 1.5 degrees centigrade? What would it take so we don't go above that? Well, the answer is it would take a lot, and in a hurry. We'd have to cut fossil fuel emissions and, of course, reduce our deforestation. We have to cut emissions by 45% in the next 10 years and get to net zero by 2050. That's really soon. People are concerned. Will people fear the trade-offs of solving another global crisis? To solve the COVID-19 pandemic, look what we have to do. We have to shut down the global economy, and people are suffering. But unlike COVID-19, I would argue that combating climate change could be free. And I've been on this for the last few years, talking about climate change challenges and opportunities. Solving the global climate crisis could be the greatest opportunity of our times. Just last month, we published, actually it came out in print in April, but this is the online version in February. A low carbon future could improve global health and achieve economic benefits. So let's take one last look of an example, and then I'll close in just a second. What's the cost of clean energy? Well, to get off of dirty coal and oil, it may be an investment cost, say up to $30 to avoid emitting 1 ton of CO2. But when you burn coal and oil, besides greenhouse gases, what else are we producing? You know, you emit fine particles, PM 2.5, sulfur dioxide, nitrogen dioxide, precursors of ozone, lead, mercury, right? Now, if you were to just look at PM 2.5, the fine particles, and ask the question, for every ton of CO2 that you avoid burning and producing, what would be the reduction of PM 2.5? And what would the health benefits of that be? And the reduction is quite striking, that, you know, you would avoid enough PM 2.5 that the health benefit from reduced morbidity and mortality and lost work days would be on average $200 for every ton of CO2 you avoid emitting. So I would ask policymakers, which number is bigger? You know, that investment cost of $30 or the health benefit of $200? And the $30 is now in question because the price of renewables has dropped through the roof. I mean, dropped through the floor, sorry. The price of renewables has dropped through the floor recently. It's much cheaper. And of course, these benefits will be even larger in very polluted areas. So this is an important slide to remember when you talk to decision makers, when they say, do we really want to invest in a maybe pricier technology? Number one, point out there's a huge health to them that the price is not so high. And according to the International Agency of Renewable Energy, actually the International Renewable Energy Agency, for the first time ever, the cheapest way to generate electricity, this is pre-COVID though, I don't know about now, but before the COVID pandemic, the cheapest way to generate electricity without any subsidies involved whatsoever was renewables and batteries. Now, for the first time ever, cheaper than fossil fuels. So there's no way, nothing that we're waiting for. We're not waiting for a solution. So some concluding thoughts. This is from Mary Robinson, the former president of Ireland, and the chair of the elders, along with Dana Reddy, wrote an op-ed about tackling climate change with COVID-19 urgency, that we really need to do this. This is from Christiana Figueres from the UN Framework Convention on Climate Change, saying, you know, we can't lose sight of climate change when we're dealing with the COVID pandemic. You know, climate change is such a crisis in itself. And I love this cartoon, you know, why don't we treat climate change like an infectious disease? So, but you know, after all, climate change is a global health emergency. So I'll conclude by saying that, you know, in the middle of a global pandemic stemming from social inequity and environmental damages, we have a huge opportunity, the opportunity of our lifetime, to seize the moment for transformative change. So with that, I thank you for paying attention, and I turn this back over to Janet and Teresa. So thank you. With that, I will unshare my screen after you've jotted down my Twitter tag, okay? And I'm going to unshare my screen and take it back, hand it back to you.
Jonathan, thank you so much. That was very powerful, very informative, and very powerful. And I'm very pleased also to introduce our first panelist, and who is, I think, a perfect follow-up to your comments. Juliana Pino she's with the Little Village Environmental Justice Organization. So those of you who are not from Chicago, this is a very important local organization, environmental justice organization, that is fighting some of the very issues, Jonathan, that you were talking about. The community, Little Village, is one of the most dense communities in the city of Chicago and has been dealing with extensive amounts of pollution, primarily related to fossil fuel industry, industrial activity, and most recently an implosion that I'll let her share with you. You can read on our bio, or on our website rather, and I'm sure you did when you RSVP'd for this event. You can read more about Juliana's work. She's been very active in the realm of policy, as well as direct advocacy and action and organizing. Has won multiple awards, both from statewide coalitions as well as nationally, and we're just really, really so excited that Juliana is part of this panel. So let me turn it over to Juliana, who is now unmuted.
Hello, folks. First, can everybody hear me?
Yes.
Okay, great. Thank you so much for that introduction. And thank you for the invitation to speak today. I'm really glad to see a number of familiar, amazing faces on the panel. And I apologize in advance because I talk a lot and I talk kind of fast, so I will try really hard to be reasonable, but please indicate to me if you need me to slow down. First, I wanted to also thank you for the land acknowledgement. I think, we have to begin by recognizing that Indigenous people have been the traditional stewards of the place that we call Chicago, where I'm still based and where I'm an Indigenous person away from my own traditional lands. In Chicago, Native folks from here still thrive, still live, and struggle, are still subject to ongoing colonial and state violence. And I think anything we say about self-determination or sovereignty, which you all noted on the flyer, if you looked at it, should be understood in that context. That lens should be always a part of how we're talking about this. About El Vejo, we've existed since 1994 as a community-based frontline organization in Little Village. Our mission really centers on organizing with community to accomplish environmental justice and achieve self-determination of immigrant, low-income, and working-class families. We work on economic justice and social change from the belief that low-income people, working-class people, people of color, understand the root causes of our experiences and oppression. And when we do that, we have the power and agency to transform society. So really anything that we do is from a position of centering expertise from the most impacted people. And you'll hear that from me several times today. Where is El Vejo situated? Starting from a place-based lens. Little Village is a majority Mexican-American community. 40% of the population was born in Mexico. We also have lots of Central American folks, Black folks, Indigenous community members. In short, I could talk about wonderful Little Villages for a really long time. It's a really thriving, dense cultural tapestry. There's so much traditional practice and agricultural knowledge that folks have brought with them. There are histories and real innovation that people want to hold on to in Little Village and that folks are working on every day all the time, even though a lot of what we hear is about how awful the industrial activity is in Little Village. There's also really thriving, incredible practices that are as present and as important to remember. And then there's just some basic economic facts, right? The 26th Street corridor, small businesses in Little Village generate the second highest income to the city of Chicago after Michigan Avenue. For folks who are not from here, Michigan Avenue is like Louis Vuitton and very fancy stores that one would expect, would generate a lot of income. But Little Village is next, up right after that. And I think keep that in mind when we talk a little bit about what's going on in the neighborhood. Thinking a little bit about Dr. Patz's presentation, I noted the phrase human incursions into nature. And I was thinking about climate change consequences as I was contemplating what to say today. And I think it has to be acknowledged that polluting industries are disproportionately and massively at fault for climate change, and individuals in frontline communities who are the most impacted by climate change can't be expected to mitigate these consequences through simple behavior change. So just gotta state that up front. A frontline perspective on this holds that solutions have to focus on this disproportionality, and we have to take leadership from the folks who are the most impacted, the vast majority of which are Black, Brown, and Native people. This means that we have to understand where the most acute impacts of industries that drive climate change are located, who is burdened by the public health emergencies and diseases as a consequence of this pollution. And we have to listen to communities when they say, what policies and practices need to change? This shouldn't need to be said, but it's so important to state this clearly. And in Chicago, these places are Little Village, the Southeast Side, McKinley Park, Woodlawn, Waukegan, Cicero, Joliet, and more. All communities experiencing regular and persistent industrial siting that contributes to climate change and is often understood as beneficial to society through manufacturing and other goods, and is not as often understood as highly detrimental to society due to causing all these other costs, visible and invisible, for the communities that are right next to these industries that are polluting. I think I also wanted to touch on the term Anthropocene. So this is a term that I personally find useful, but I also struggle with, because often in the academic literature, when we're thinking about Anthropocene, you're thinking just about mass extinction events, you're thinking about human causes, but it doesn't have what I think is necessary, which is an explicitly political lens. And so, because I'm first, I might spend a little bit more time talking about this than I otherwise would. But one thing I wanted to emphasize is that we have to understand that a key driver of the Anthropocene is colonialism, is racial capitalism, and is oppression. That's just a fact. The exploitation of the land and natural resources goes hand in hand with exploitation of humans stewarding the land and the devaluation of Black, Brown, and Indigenous bodies on that land. The fossil fuel economy, we talked about, in many contexts as being a major factor in climate change, only thrives when nature and our bodies are continually exploited. And this is also true for other industrial actors. Little Village itself is a microcosm, I'd say, of this reality. It's a historically important native geography. Later, it was land, that was used for industrial agriculture, where Black and brown people were indentured and labored, enslaved. Later, it was a site of migration and immigration, and a site of incarceration, and a site of industrial pollution from dozens of industry facilities. The most well-known of these is the Crawford Generating Station, and I'll also note the nearby Fisk Generating Station in Pilsen, which borders Little Village. When running, this facility emitted massive amounts of pollution, to the tune of causing 43 premature deaths per year, thousands of asthma attacks and emergency room visits, devastating economic consequences, all on a low income and working class community. And so, despite the earlier thing I said about the city profiting from the community, the city, the county, the state, the federal government's view, which we can assess through their policies and actions as opposed to their words, what they say is less important than what they do, is as a site of extraction. And this plays out through racial capitalism. In Little Village, the industries continue to enact violence modeled by settler colonial state practices, and they continually dispossess community members of their ability to make comprehensive choices about the land on which they live, about how to live, about their right to access clean air, water, and land, and their right to access culturally specific practices and traditions connected to our right to access that land. When Albejo has worked with leaders from across the city to shut down the plant, which folks may be familiar with, shut down in 2012, none of the emerging plans, sites, principles, or practices, including from city-supported processes, would have allowed where this site is now. That includes a multinational global industrial who purchased the site with the intention of developing a 1 million square foot warehousing and distribution facility. That was not in the plan. So I'd say, when we think about climate injustice in light of this, climate injustice looks like sites maintaining their exploitative character, perpetuating harm, instead of moving through a community-led just transition. In this case, you have a toxic fossil fuel industry plant that will be replaced by a future toxic transportation industry warehouse. The tenant is currently planned to be Target, if anybody cares. These big commercial companies benefit from this. They have terrible labor practices. Instead of the community visions of workforce training and indoor agriculture, mercados, and more. So the site will move from a climate change and climate injustice driver in the power sector to a climate change and climate injustice driver in the transportation sector. In Illinois, it's important to note the transportation sector is the leading source of climate change here. And on a macro scale, Illinois sees 1/3 of all manufactured goods in the United States. These goods come through transit hubs, And the concentration of those direct impacts is in only a few communities, the ones that I've stated and more. This is important to mention because it's so regular. Many of you may also be aware, and Dr. Gordova mentioned this, that Little Village also recently experienced a somewhat high-profile environmental disaster at the hands of people who thought that it would be appropriate to implode a century-old coal plant stack at the Crawford site that I mentioned, and that it must move forward as it was already permitted. We tried desperately to stop it. We found out, a day in advance. And despite our efforts, the efforts of many people, officials and the company failed to stop it. And this reckless and deadly event dispersed a blanket of toxic dust over the Little Village community. And this explosion also shook all of the lead service lines in the community. Those lines deliver water into homes and further compromise drinking water quality where it already wasn't clean. This should never have happened, especially during a respiratory illness pandemic. This directly made it difficult for folks to breathe in a place where the pollution is already extremely bad. That said, I want to make sure to emphasize that these environmental crises are very regular events for Black, Brown, and Indigenous people. These are the norm and the de facto standard, and they're often upheld and permitted by this nation state and all the jurisdictions under its system of laws. This crisis was in essence an additional crisis on top of a persistent public health emergency due to these polluting industries. So you see it just compounds, and it's important to understand when we're talking about climate change, this is the reality of that climate change for communities who are experiencing these actions again and again and again at the hands of industries that are the ones driving the consequences that everybody's going to pay. When it comes to the pandemic and COVID-19, Little Village is also one of the most impacted neighborhoods in the state. Little Village contains the zip code with the second highest number of COVID-19 cases. Little Village is also the home of Cook County Jail, one of the largest single-site municipal jails in the country, and where Black and Brown people are largely incarcerated, many of whom are pre-trial. They haven't even gone through a process that says, hey, you're guilty, a state process. And they're incarcerated due to their inability to pay bonds. So these are folks who can't afford to buy themselves out of pretrial incarceration. Cook County Jail houses many community members. We consider people in the jail to be community members while they're living in Little Village. And it itself is one of the sites of the most severe COVID-19 outbreaks in jails in the country. And if folks are following the news, you know that jails are the site of many COVID-19 outbreaks. In these ways, COVID-19 is an environmental and climate justice issue. So many community members, including folks who are incarcerated in the jail, live with chronic respiratory and other medical conditions as a result of decades of living with dozens and dozens of industrial facilities in and around the community. These underlying conditions, as you will hear in the COVID-19 talk on the media, they combine with structural oppression to set up community members to be most at risk. We're seeing that play out now with deadly consequences. And as Dr. Patz noted earlier, pollution plainly increases that risk. Again, here Little Village is a microcosm. It's in this time, we have to acknowledge that the incredibly tragic outbreaks in Little Village and in Black and Brown and Native communities all over the continent are the result of concentrated and severe injustice and dispossession. Communities are under-resourced, polluted, left to mitigate the consequences and navigate, if they have any, to access public health systems on their own. Here, our public health systems are stretched and underutilized by community members due to language barriers, concerns about immigration, detention, and deportation, cultural misalignment, and other factors. In Chicago, we don't have a city public health department with a solid track record on environmental health and structural causes of health disparities generally. Instead, they historically have focused largely on critiques of individual decision-making and the denial of their own historical practices and policies that have led to their reality now. This is important to note because it's not just the exposure to the pollution, it's also that the community is set up to fail when it comes to mitigating that exposure. There's not a system that folks can access to get the resources that they need to take care of themselves. The system is set up to blame them for their life outcomes as a result of their decision-making. And this is a very difficult context in which to introduce a respiratory pandemic, because then on top of that, you have folks desperately trying to provide services in that system that's largely failing community members. The individuals providing those services are doing the best that they can, but they're also not institutionally supported to do what they need to do to serve the people who are most impacted all the time. And that doesn't change right now. So that means that folks are still staying home longer, not accessing the doctor when they need to. If they try to, sometimes they get denied, things that I think are less reported, but are very, very important to how we understand the confluence of events that are resulting in communities like Little Village. Despite all of this, I think Little Village generally is responding to this moment, responding generally, I'll speak about in a minute, but responding to this moment with the strategies that we have been using, sustained organizing, direct mutual aid, providing resources and redistribution of funds, growing of food, and distributing other goods for basic survival to support community members during this time, because actually basic survival is the bar right now. Folks need as much support as they can get from places that are not looking to capitalize on their existing distress or to potentially profit further, right, in the way that they have been profiting from the community overall. Generally speaking, Little Village has been fighting back through land stewardship, through self-determination, through systems change visions and policies. Folks have expressed a community vision for the land that rests on the idea that that folks know what they want, that they can enact independent governance, that they have alternative systems, and that those will promote being rooted and fight against displacement. I think folks have really pushed things like energy and climate policies, utility shutoffs, economic justice things, have backed up decarbonization, have really done complex and really critical work to advance the fight against climate change, but to also address the very crucial and very local solutions that are needed here. I have a lot of thoughts on what institutions can be doing to support right now, and I think I'm excited to hear from the rest of the panel. I really think the richness of this presentation will be borne out in our discussion, but I wanted to make sure to lift up some of these things right at the top, so it's really clear that when we're talking about climate injustice, when we're talking about COVID-19, the impacts are concentrated, and those places are the places where the solutions have to be drawn from.
Fantastic. Thank you so much, Juliana. Janet, you're going to introduce Warren?
Yes, I am. Thank you, Juliana. So we're going to move on, and I think we have a really great panel of people with a lot of variety of experiences. And so our next person is Warren Levy, someone I've known for several years, and I think he comes with a very unique perspective. He is a lawyer and an adjunct associate professor at the University of Illinois down in Urbana-Champaign, and he teaches specifically on environmental law and policy in the College of Law there, as well as for the campus honors program in Champaign, for whom he is really influencing a lot of our future leaders in climate change and law. He's also on faculty at the School of Public Health here. He trains in health law and other students on climate competencies and policy advocacy. He practiced law in the federal government and at a global law firm for 30 years. And he advises both government agencies and nonprofit organizations on sustainability programs and policies. He earned an undergraduate and graduate degree in law and applied mathematics from Harvard University and a graduate degree in economics from Cambridge. So I take this moment to really welcome Warren and really look forward to hearing what he has to say.
Great. Well, can you hear me?
Yes.
Yes. Okay, great. Well, thank you very much, Janet, and thank you for having me on such a wonderful session. Let's see, Jackson, I think you have a slide for me. Yeah, great. So, I'll just quickly go through these three topics to give a perspective from environmental policy and law to add to what Jonathan and Juliana have said. So, within the topic, next slide, please. Within the topic of local resilience, I'm going to pick up three specific areas. Green recovery is first. And Jonathan talked about continuing to pursue climate solutions while we are trying to recover from COVID-19. And it really can take one step further, and that is to strengthen climate resilience as part of the programs for the economic recovery from COVID. Now, this takes planning and commitment throughout government programs, but there are some hopeful signs. Last Wednesday, 11 mayors who are leading the Global Mayors COVID-19 Recovery Task Force made an announcement. These mayors include mayors of Los Angeles, New Orleans, and Seattle. And LA Mayor Garcetti said, "Our efforts will define our cities for decades to come. And as, and as mayors, it's our responsibility to lay the foundation for the fair society and healthy planet our residents deserve. Cities will marshal all of our local resources to advance a robust global recovery, to get people back to work and accelerate action to address the climate crisis." So as part of this discussion of the global mayors, they talked about measures ranging from huge retrofitting programs to make buildings more energy efficient, to mass tree planting and investment in solar and wind. And all this should sound familiar for people in Chicago and many other cities. We have these blueprints. In Chicago last year, the Resilient Chicago Plan provides for many actions to reduce greenhouse gases and adapt to climate change, with attention to job creation and disadvantaged communities. Smaller cities also have or should develop sustainability plans with specific targets, actions, and job training programs. Now, one example is New York State. On April 3rd of this year, New York passed the Accelerated Renewable Energy Growth and Community Benefit Act. That includes some provisions called host communities benefits that provide for tax incentives and utility discounts for siting renewable energy facilities in those cities. Now, more broadly, green deals for COVID recovery have strong support in France, Germany, Britain, South Korea, and from leading global investor groups. Now, unfortunately, this year, Congress and the administration refused to use the massive recovery spending to fund climate resilience. But the 2009 American Recovery and Reinvestment Act provides some guidance for cities and states. That act would dedicate $90 billion from the Great Recession recovery to promote clean energy in renewable energy generation, energy efficiency, clean transportation, and job training. So there's a lot of options. They create jobs, get our economy moving again, and promote climate resilience. The second topic, local actions need to be undertaken. They need to be undertaken now. Our communities have vulnerabilities to reasonably foreseeable disasters, including communicable diseases and climate change. This is a lesson from COVID-19. Preparing for these disasters saves lives and is much cheaper than dealing with them in the absence of plans and systems. State and local governments should act now to identify their vulnerabilities and build resilience. As shown in both COVID and climate change, the federal government should not be relied on in terms of providing resources and leadership in preparing, managing crisis and recovery. So just to give a local example, in June of 2019, Mercy Health filed a lawsuit against the city of Rockford, Illinois, related to flooding of the hospital. The hospital cited the inadequacy of the sewer system, part of the reason that a 5-inch rain caused more than $30 million in damages to the hospital. 4 heavy rains within 12 years affected the hospital's operations. And just last month, Mercy Health announced that it would be this very flood-prone hospital that would be the focus of its care for the COVID patients. So we need to learn from the COVID experience and take local actions to strengthen our climate resilience. And the health sector really should be in the leadership on these efforts for climate resilience. And just to take an example, again, it wasn't until August of 2019, for the first time, that the Peoria County Board of Health issued a position statement that recognizes the need to address the environmental and health impacts of climate change through education, risk assessment, adaptation, policy development, and mitigation planning. And it should include all populations, especially those that would have disproportionate negative effects. And the final point here on local resilience is that health matters. Residents of all communities have been willing to make major personal sacrifices and bear high costs in order to reduce COVID illnesses. And if communicated effectively as a health determinant, the same should be true, or at least to a significant extent, for mitigating and adapting to climate change. So I just point out that we have a very important piece of pending legislation in Illinois, the Clean Energy Jobs Act, that will likely be delayed because of the focus on COVID. And COVID is stalling renewable energy installations in the state and nationwide. And it really should be public health care professionals and medical groups that step up and educate legislators and the citizens on why to move forward on these kinds of plans. Okay, next slide, please. I'll just go quickly over my last two slides. So one is capacity building. Another lesson from COVID-19 is that community resilience requires capacity building to face clearly foreseeable existential challenges. COVID has shown a lack of competency in systems and personnel training, really in all sectors of our society. Whether it's health professionals and lawyers, financial professionals, manufacturers, food suppliers, and others. All these sectors need knowledge, skills, and capabilities in environmental and other huge threats. And we have to integrate this training throughout curriculum. And it's inadequate to just train a small group of specialists, such as in infectious diseases or climate change law or stormwater management, when a threat really goes to our very way of life. So the American Medical Association, the American Bar Association, and others have urged for greater training, but major universities are really not providing adequate curriculum to reach out and build competency throughout our communities. And the final slide, please. All right, so just for a few seconds on protected areas, Jonathan pointed out that spillover comes about in part because of the incursions on wildlife areas. Just from the perspective of environmental policy and law, we get it. We understand the science, and we have principles to support conservation and protection against spillover. We have legal protections on the international level and in national laws, but what we really need to do is to increase enforcement. We need to increase political support. And finally, we need to increase justice. And as Juliana said, we have to look at local communities, and we have to secure livelihoods and benefits, not just in urban areas, but also in wildlife areas, and to make sure that the people in those areas do not have the incentives to take actions with regard to wildlife that lead to greater spillover. So I'll stop there, but thank you very much for having me as part of this panel.
Warren, that's fantastic. And I'm loving the different dimensions that the various speakers are bringing to this. I'm going to turn immediately to our next speaker, which is Rachel Haverlock. She's a associate professor here at the University of Illinois, Chicago, and importantly, a co-founder of the Freshwater Lab. A lot of her work is in the Middle East and looking at the role of extractive industries in the militarization of the Middle East. But she brings fresh water is very central to her analysis. So Rachel, let me go to you next.
Okay, thank you, Teresa, and Janet and the whole staff at Great Cities for organizing us together around this topic, which I guess is exactly what we should be talking about and contending with and collaborating over. So the general tenor of my remarks today is going to be to think about the important shift from our conception of global climate change to really thinking about very local, regional, and as I would call them, bioregional or watershed scales. And one example of how I think this can work or does work is in Dr. Patz's slide about sites with the worst air quality and the concentration of that poor air quality and susceptibility to COVID-19. Of course, our eyes always fall to where we live, right? Our immediate question is, if the air is quite toxic, what does it mean for me and my body and those of the people I care about? So how do we operate on that scale? Well, first, I want to add on here, because we are talking about decarbonization and we are talking about getting off fossil fuels, and fossil fuel is also fossil capital. So when we address the negative externalities concentrated, as Juliana said, in low-income communities of color, and even in communities of color with some wealth, that this is part of an economic system. And it is exactly that needs to be dismantled in conjunction with any kind of mitigation of the negative effects of climate change or any kind of resiliency or survival. And so what is key, especially if we're thinking about post-pandemic reconstruction, if we're talking about economic plans, it is vital to shift the ownership structure. Decarbonization is also about moving the agglomeration of assets. And these are also our public infrastructure and our natural resources are considered assets which are acquired by global capital. So we cannot avoid diseases, in my estimation. We cannot do the necessary shift off climate change if we do not engage in a deeply redistributive process of literally telling global multinational corporations to go fund themselves and to get off the remaining assets that are held publicly. We heard two other shocking examples in the presentations of my colleagues here about the sewer system bursting in Rockford and flooding the hospital, and about the implosion of the Crawford coal tower shaking the lead pipes, which of course happened and hadn't even crossed my mind. So we are now operating our water systems on infrastructure built in a moment of federal confidence, built to be large and unwieldy. And so we are stuck with these systems that haven't adapted to the climate, haven't adapted to population moves, haven't adapted to technology. And there simply is no federal funding to maintain them, to change them, to update them. And just this morning, I read an article that in the federal money made available thus far, there's nothing for municipal water systems. This is, of course, during a pandemic in which water and washing your hands is the closest thing we have to a vaccine. So we are experiencing this when a high percentage of residents and citizens are living without water, and when we are losing control even over the aging infrastructure that is supposed to that is supposed to sustain us. The article this morning said with no federal funding, with cities and municipalities facing increasing bankruptcy and low revenue, that private water corporations are likely to snatch these up. I know that Warren just mentioned Peoria. Peoria is in a decades-long struggle to get their water system back from Illinois American, which, because of House bills in the state of Illinois, has been seizing municipal water systems, buying them up, cutting costs as private equity does, right? The game is for a corporation to seize a public asset, to seize it cheaply, then to take out a huge loan, then cut costs, cut down on labor to raise costs. And so then you have people paying more for worse service. So obviously, as you can already tell, I could go on about this, but let me jump ahead. There are many local and global examples of how private equity and multinational corporations dispossess, continue to extract, and literally absorb public funding to dispossess, to poison us, and to leave us jobless and at their mercy. Okay, so to bring this to some kind of succinct conclusion, I think we need to shift away from this notion of global climate change. Now, of course, it's what it is, and of course, the pandemic is showing us our interconnection, but when we operate on a global level, we are paralyzed from reclaiming infrastructure and what private industry calls resources. I am not comfortable with that term. I continue to be a student of indigenous conceptions of interrelationship to water and other species and air, but whether we conceive of this as reclaiming what is ours in a kind of an ownership scenario, whether we conceive of this as resource sovereignty, or whether we conceive of this as being guided by indigenous stewards to understand interrelationship, we simply have to quickly get private equity out of our regions. I think that this is most pressing when it comes to the North American Great Lakes. Here, we still have a principle of public trust, wherein the surface waters of the lakes and the rivers belong to everyone resident in the watershed, to other species, and to future generations. And we've got to hang on to this public trust tightly right now. This, first of all, is extremely important when it comes to regulation. We are in the midst of a massive federal project of deregulation when it comes to water. For example, the Clean Water Rule has been completely disbanded. And as we go on in the conversation, we could chronicle this horror. I read another article in which the Clean Air Scientific Advisory Committee was disbanded by Andrew Wheeler, the so-called head of the EPA. They reconvened themselves to argue with the threshold of the federal EPA. We need, people of the Great Lakes Basin, we need to set up our own committee on water quality, on mitigating flooding. We need to do it quickly, and we need to build on the many decades of Great Lakes legislation. In conjunction with this, we need to address the historical racism, deindustrialization, and segregation in the Great Lakes Basin. And as Juliana, as usual, helps us to see, this is the place where the most impacted people need to lead. not only because this has to be a site of reparation and healing, but also because people at the front lines, one, know in no uncertain terms what they and we are up against, and also know how to find those solutions. So we need to create watershed regulation. We need councils for addressing things like water distribution and infrastructure. And next, primarily getting back to this, reclamation of our own assets. We need to, for example, chase Nestle off Lake Michigan, Aquafina and Dasani off of the Detroit water supply. And we need ourselves locally to think about a beverage industry, biodegradable containers, delivery systems, water reuse. And so when I say this, the question is, where does the money come from? I mean, we have the money within. We're talking about billions and billions of dollars for multinational water bottlers, as like 15% of the people in Detroit where that water is taken have no water. So we've got to do this at the regional scale because the assets become clear. In thinking about things like replacing the pipes, recycling our water, having new industry, we have to remember two things. One, that our tax dollars and our labor subsidize the privatization of what belongs to us and other species in the ecosystem. And two, we have to remember that these corporations secure massive loans in order to extract and emit. And so right here, with this language of it is ours as a region and that this is reclaiming as part of rebuilding, I think that we have a unique chance in this part of the world, one, to redress historical wrongs and violence, and two, to really make a beautiful Great Lakes Republic that could maybe survive this era and could certainly absorb people not based on random thresholds by Stephen Miller, but in fact, who and how many people were able to absorb. Thanks.
Fantastic. And I think this whole issue of the private ownership of our infrastructure and the way that is occurring, and particularly as it relates to our water, is so important. Thank you so much, Rachel, for bringing that into the conversation as well. I'm going to turn now to Pam Tully. So excited that Pam Tully is also part of this panel. She's an elder activist, Asian American elder activist. She's retired from the Center for Occupational and Environmental Health at UC Berkeley. And she has been for 30 years very active in the environmental justice movement, and was one of the contributors to the Principles of Environmental Justice, which was conceived at the first People of Color Summit in DC in 1991. I think it's important also that Pam, in her work, some of the work she's going to share with us is going to bring into this conversation also the labor component as it relates to what we've been talking about. So with that, Pam, let me turn it over to you.
Thank you so much. The title of my talk is a Worker Protection in the Time of COVID-19 and the Reopening. And the week that Teresa reached out to me to this panel was the week of my mom's 95th birthday. And she lives in a nursing facility, and I had planned to throw her a really big party. That week also was the week that my son was called back to his workplace. So Teresa's ask came at a time for me when safety of my son, safety of my mom, and safety of my mom's caregivers was really heavy on my mind. So I really appreciate this opportunity. Next. So this opportunity also gave me, pulling me out of retirement here, got to connect with some of my colleagues at the National Institute of Environmental Health. And in particular, I want to thank them for coming out with this publication just a few days ago with Chip Hughes and Jonathan Rosen. Thank you very much. I'm going to be referring to information in this resource, and I really hope that each one of you can look into this, and I think that there will be some lessons to be able to guide you as we address this issue of COVID-19 and the reopening of the economy next. So essential workers are not expendable. So yeah. This is my mom on the right side. That's my lovely 90-year-old mom, whose care is provided by 3 wonderful people, Marisa, Lee, and Connie. Pictured here are, along with Marisa, are other expendable, what we call essential workers. I wanted to draw attention to these because for me, I'm a retired instructor, and I've been hearing from my peers that all of my friends are on the verge of a nervous breakdown right now, preparing for their classes, learning long distance techniques and everything, and also managing their families, what it means to be sheltered in place. And so for them, it's the struggle and the challenges of long distance learning, and combined with the reproductive labor that's associated with this particular moment. I wanted to also talk about the postman who talked to me, who's worried right now about the privatization of the postal service. And I asked him about his masks, and he has a mask that he wears more than once a day. He has to kind of keep wearing the same mask to do his work. I wanted to share a lot of other about the worries. For my mother's caregivers, they're not only worried about their situation here as caregivers and their relationship to the disease, but also they're worried about their family members, for example, in the Philippines, and the violence that has escalated in the Philippines in the name of enforcing COVID-19 shelter in place. And then now we also all know about the lack of preparedness and the need for PPE for our frontline workers, the nurses and everyone else, the transit drivers. And then finally, I want to talk about being so concerned about this next period of reopening the economy. This is got tremendous concern for us and everybody. And while we listen to the news, they talk about maybe the safety of the meat, but for us, we need to also talk about protecting the health and safety of these workers. Industry, on the other hand, is more focused on the economy right now. And in Oregon, just a few days ago, the agricultural industry has been pushing back on a temporary regulation that will be protecting farm workers in regulation that is calls for physical distancing for them and the sanitation of high contact areas. They're pushing back on this and saying that they're needing to prioritize their economic pressures right now, and that this regulation is coming too soon and is taking away from what they feel is needed for the countries. Smithfield Foods right now is requesting flexibility on the guidelines for them. I feel like for us, we already understand that this is just absolutely inappropriate, that as public health people, we really need to continue to really push and demand rigorous practices that provide maximum health and safety. We cannot let the agencies compromise for the purpose of economics. And for the purposes of today's talks, next, I want to go into this definition of essential workers for today's talk. Technically, these are workers who provide essential services and must report to the workplace during the COVID-19 outbreak. And these are workers who cannot work at home and are at risk at being exposed to the disease. And the County of Santa Clara, I like this definition that NIHS also is promoting for us to understand, is that essential services are defined as those necessary to protect the health, safety, and welfare of the community. Next. So let's take a look at some of the disease exposures of these essential workers. And we have data here that was collected in 2008. And they include the rates of physical proximity to the disease, face-to-face interactions, and that you will see that the rates here are very high. And now when we are going to be looking at 2020 rates, we all know that those will be jumping significantly higher by the hundreds, in some cases maybe by the thousands. So I wanted to be able to identify that in terms of the exposures of essential workers right now. And here's a chart that you can look at later. But also on this chart is showing the median hourly income wages for workers. And I feel like in terms of this particular statistic is also important for us to understand, is their exposures to disease and the income associated with that, with addressing care and exposure. So next. So what is the current responsibilities then in terms of providing a safe and healthy workplace for these workers? And basically, I want to read this, that the employer and workers' responsibilities have under OSHA Act is 1, the Occupational Safety Health Act requires that employers provide a safe and healthy workplace free of recognized hazards and follow OSHA standards. And 2nd, workers should participate in the development and implementation of workers' safety and health policies to help ensure that they are appropriate and implemented. So most of us are very familiar with the first part in terms of knowing that the employer is supposed to provide a safe and healthy workplace, but we are not that familiar with knowing that workers should be able to participate. And for me, in the interviews that I have with workers, that this is a very difficult situation, that they are having to make a choice between having a job and being able to speak up for decent work conditions, including health and safety and wages. And so what they have to live with is what we call unfair choices between having a job or working in very challenging and difficult and in often cases deadly workplaces. So basically for me in this place and as been addressed by earlier speakers, is that those that are in the front line, and we're talking about workers here, they need safe spaces to be able to speak up, to participate in the development and implementation of health and safety policies. So what does that look like? Next. If we're wanting to look at here for a start, is being able to analyze the workplace conditions and be able to find a way to control the situation and make it prevent hazards from existing. So these are 4 stages in involving workers, and it's our it's our hope, or we're seeing that in this period of the reopening of the economy, that the country will not and should not, as speakers have already said, return to past ways of doing things. There has to be something else. We need to look at who should drive this change. And for me, I feel that workers need to be at the front end of helping to drive this change. And it starts here first at the workplace, and will be able to trickle out and expand based on what they are able to accomplish there. So next, what does that look like? Everyone here, as I know, has probably gone into a grocery store in this period of time, and has looked around and seen that there are various safeguards. And here we have, like on the floor, markers or statements that tell people to be able to stay a safe distance apart from each other. So when we look at this, this is mainly for us as customers in the store. But now when you go into a grocery store, I want you to think about not only for your safety, but what about the safety of the workers? Is this enough? Okay, is this enough? So let's take a look on how to figure out if this is enough. Next. Because we're in the field of public health, we are into prevention. And so making the workplace safe means that we look at being able to control the risk. Here, there's often signs when you go into a workplace that says to be safe, be safe. Well, that is not enough. A safe workplace has to have a combination of methods that start with the most effective, and you can see that starting up at the blue and going down. So being able to have a safe workplace, when you go into that grocery store, take a look in terms of, okay, the risks here. How does it physically remove the hazard? How can we have controls that physically remove the hazard? Replacing of the hazard, isolating people from the hazard, or policies or rules that change the way people do the work. And finally, what is in place that protects the worker? And it's usually with what we call, and you know now, PPE, personal protective equipment. So the next slide here kind of shows next is some of the ideas in which, for me, when I'm thinking about this moment of workplace exposures and exposures to disease, and combined with being able to protect Mother Earth and the environment. These are some of the things that I kind of came up with. And later on, you can, possibly come back and take a look at these. But I feel that starting with learning to live in balance with Mother Nature, being able to work to make sure that we have policy and system change that works to restore and protect clean air, water, and soil, substituting dirty-based fuel economy with clean energy-based economy, and my list goes on. Let's go on to the next one, because I don't have that much time. So right now we see that with a lot of the changes that are happening in this past month, that there are some potential for some new norms. One of these is a new way of greeting each other. No more hugs. And everybody who knows me, I love to hug. But there are other things, such as in full service cars, policies of zero contact when a mechanic is doing full service for you. And these are other things that I feel will become potential norms. One is the dealing of mental health and relieving anxiety. These are things that are coming up in this moment, I think are very, very good. But this is not enough. We need something more. Next. Next slide. And that something more is I want to be able to share is, you know, what could something more look like? Everybody here and all of the 126 participants that are listening in now, we are all change makers. We all have potential. And as somebody already said, we have solutions now. And these are some of the things that I just wanted to share with people in terms of a framework that can capture not only with the workers being able to work and have a voice in making the workplace safe, but that work then being able to expand into community and that work being able to have an impact globally, locally. And so for me, different things, again, I want to stress, and it has been said over again, is learning to live in balance with Mother Nature. For me, worker rights is really important, the right to join a union. Making sure that we know that essential workers, actually essential workers have always been, the workers have always been essential prior to COVID-19, but now this is being able to uplift the value and the contributions that they make.
Thank you, Pam. That's, I'm sorry, were you finishing or were you going to say something else?
And so thank you again for this opportunity, and yes, together we rise.
So I really appreciate that you brought in the labor part of this, as well as the everyone has really talked about the various kinds of solutions, and there was a phrase you used, you know, about the sort of reconstruction that we're going to be needing to do when we move into this post-pandemic, or even as we go through it and then come to the other end of it. I want to go next to Dallas Goldtooth, and then we're going to go to Jerry Krishnan, who's now joined us, who's been on the call for a while, but we have him a little out of order. Dallas, I think it's really important also to have Dallas's perspective, because we've talked a lot about the extractive industries and the role that they play in climate change. And Dallas is with the Indigenous Environmental Network, and you can see again if you go to our website his bio. But he is a second generation EJ activist, and is also he's from the Metaquantuan, Dakota, and Dene. And I'm going to go ahead and turn it over to you, Dallas, instead of spending a lot of time on the introduction.
Thank you so much. Can you hear me okay?
Yes, you can. Thank you.
Awesome. Well, I'm so happy to be here, relatives. I am coming to you from traditional Three Fires Confederacy territories, which is now also so-called Chicago. I'm Dakota and Dene. I'm an organizer with the Indigenous Environmental Network. And I'm so thankful to be a part of this conversation, with us connecting the dots, really, for a lot of our communities who are a part of the environmental justice movement. You know, it's all a matter of connecting the dots, because we realize that we're not just having a conversation about ecological preservation or conservation. We're actually talking about, you know, how do we build a world that's just, that is sustainable and renewable, that is in line with our own local practices and traditional knowledge formats. And it's no different with the current COVID-19 crisis. And I don't have a lot of time, so I'm gonna throw as much as I can out there. But really, you know, there's a lot of things in my mind when I'm thinking about, and I think that it's already been said, and it has to be said, that for a lot of Indigenous communities, because that's the communities, those are the communities I work for, those are the communities I come from, an Indigenous community itself. And you know, from our perspective, that we can't, any analysis of, you know, mitigation efforts, any kind of approach to mitigate or to address the issue, not only for this current pandemic, but for future pandemics, if it is not accounting for settler colonialism, if it doesn't account for CO2 colonialism, then those are faulty analyses. Those analyses will fall short of actually addressing the problem themselves. It's something that I've heard numerous times, is that we're seeing we're seeing Black, Native, Latino communities have a higher infection rate than other communities. And I really want to challenge us ourselves to see it as not just that, oh, it's because they are people of color that they have a higher instance of being infected by this virus. Instead, see it that the conditions of our community and the conditions that we have not had much control over, that the state has defined, has dictated us to be at higher risk, meaning we're closer to areas of pollution. You know, we're dealing with toxic waste in our backyards. We're dealing with a lot of environmental racism that's causing for us to be to have higher instances of compromised immune systems. I wanted to point just directly to just some facts. I'm throwing them out there, and you can follow my on my Instagram. I just posted a really awesome video on my Instagram, if those of you are on Instagram, of a Native youth really breaking down the facts. Right now, the major crisis in quote unquote Indian country is focused on the Navajo Nation, which is in the so-called Southwest United States. The Navajo Nation currently has over 2,300 identified cases and 73 confirmed deaths. Navajo Nation, which is a sovereign nation, and I think they have over like 200,000 citizens, but it's 27,000 square miles. It's larger than the state of West Virginia. And if Navajo Nation was a state, it would be I would have the third highest infection rate in the country, behind New York and New Jersey. In West Virginia, they have 163 grocery stores. In Navajo Nation, they have 13. West Virginia has 63 hospitals. Navajo Nation has 6. There is a serious, what this virus is doing is exposing the inherent inequities within our capitalist system. It's exposing the inherent inequities of extractive economies that our system is based upon. And it's putting our people in the crosshairs for death and for further related issues when the system breaks down. A lot of Native communities, especially remote communities, because there's a difference, over half of Native communities live in urban areas, but the other half live in rural communities. You know, we already are dealing with the lack of clean water or running water. Some communities like the Navajo Nation not all the community members have electricity. So communication is a real issue. And I think the other thing I want to land on that, it's just been on my mind, and I have to say, because actually I've been challenged by some of my sisters, is that if our COVID-19 response or awareness event, our talking points doesn't include the concern of gender violence that's related to the pandemic, then it's incomplete. Especially when we're talking about impacts within quote unquote Indian country, where women and children are already experiencing higher rates or higher levels of vulnerability. Like domestic violence is a public health issue, sex trafficking is a public health issue, and with this pandemic, there's genuine concern about the increased rates of that as individuals and people are in unhealthy situations, locked in their home in unsafe scenarios. And that's just not an issue just pertaining to Native communities. A lot of other communities are experiencing that same thing. So we have to really understand the long-lasting effects of this pandemic, but also what I'm trying to get out there is the conditions for how bad it is in our communities was there long before this pandemic even showed up, and 2, are conditions not of our own creation. We live in a system that prioritizes the health and the embetterment of a select few for the detriment of the many. And as we talk about addressing this current crisis with financial stimulus packages and aid, if we're not talking about changing the system itself, then we're just setting ourselves up for more failure, not only for us as humans, but also for the entire planet. And I think that's what our relative, my auntie Pam Tully was speaking to. How do we get back into balance with ourselves, but also with the land itself and with Mother Earth? I just want to finish up just with I'm going to do a screen share here. Can you see that? Yeah. I want to finish up with this, that we are part of this effort called the People's Bailout, but it's also something larger that our IEN is a part of with in our relationship with the Climate Justice Alliance. We're members of the Climate Justice Alliance. We're also members and partners of the It Takes Roots Alliance. And it really comes down to this people's bailout. I want to focus on, there's been, I think, 5 different asks. And one of those asks is making a down payment on a regenerative economy, preventing future crises. I think I've heard numerous times this discussion so far about different ideas and things that we need to do in order to prevent future catastrophes. And I wholeheartedly agree. We have to change the way we work. When we have discussions about the status quo and returning to the status quo, for a lot of impacted communities, the status quo was already killing us. So why should we return back to that scenario? IEN has developed our own Indigenous principles of just transition, which help kind of lay out the path that we see as we look towards building a regenerative economy. You know, what a major part of that approach is reevaluating our responsibility and relationship to the land itself. Rejecting the idea that we need to commodify nature in order to build sustainable economies. There's a strong focus on sovereignty and recognizing the inherent rights of Indigenous peoples as a distinct way to protect the land, to protect our water and air. And really focusing on the different mechanisms that people are taking to take action. You know, whether it's community-based healthcare and healing centers, sustainable community-based planning, you know, energy justice, energy democracy are at the forefront of this fight, and it can't be overlooked. And the last thing I want to just speak to, and it's a plug, is that because Indigenous communities are at a very vulnerable state right now, our organization, there's a lot of mutual aid funds out there. Our organization is a part of it, and we're helping try to support Indigenous communities on the front line in both North and South America as they respond to the to the COVID-19 crisis. So you can also support our network and our grassroots base by helping us out with our fund, which you can find out on our website. And I'm gonna go back to you. You see me now. Hi. My last thing is, I know families, I have relatives, I have friends who live in remote Alaska, who live in the Amazon, who also live on a Navajo res, who live in Chicago, and we're all afraid, because we're not just afraid of the pandemic and the virus, but we're also afraid of how the current economic system and oil and gas is going to try to get back full steam ahead in response to this moment. And we're afraid of what that's going to do to our communities, our lands, our air, and our air and our bodies. And if there's any moment, we can't wait until this pandemic is over to take action. We need to take action now. And so I thank you so much for this space. Thank you so much for listening to me. And I hope I contribute to this conversation in a positive way.
You absolutely did, Dallas. Thank you. So powerful. And I'm really glad you also brought into this the impacts on some of the impacts related to women, and also just, I think, the importance of the feminine voice in all of this. There's just so many aspects that I think were very powerful. I'm sure all of you are really blown away by the different dimensions that are continuing to be brought in. Obviously, we're going back past 3 o'clock. We had originally set this for 3 hours, but we will go past 3 o'clock. And for those of you who can hold on, please do. We've still got 3 more very powerful speakers. Jerry Krishnan is next. And I think if you're ready with your slides, you can just do the share screen. And hello, how are you? Janet, you want to go ahead and introduce Dr.
Sure. Yes. Thank you, Jerry, for joining us. So Jerry Krishnan is a great researcher, and I actually really wanted to try to tie the link between what Dallas just mentioned and really kind of Jerry Krishnan's work and his expertise. So for Dallas, I think, you said something in regards to COVID-19. It's not just affecting and disproportionately affecting people of color, but it's the conditions of the community in which we reside that's actually putting us at risk. And I think one of the key things with Jerry Krishnan is really working with kind of the respiratory pulmonary illnesses and focusing on asthma. It really brings to light a lot of those issues. So Jerry is a physician scientist. He is a pulmonologist by training, and is grant funded by several federal funds, i.e. the National Institutes of Health, as well as the Patient-Centered Outcomes Research Institute, really looking at this. And I think this is bringing in a unique perspective of the clinician and really looking at some of the air and pulmonary perspective and aspect of this, and really this discussion related more broadly to COVID.
Great. Thank you so much, Janet, Teresa, and all of you for giving me a few minutes today. I'm dressed this way because I'm actually in clinic and just wrapped up seeing some patients, and I haven't had a chance to put on my shirt and tie, so you'll have to bear with me. Teresa, I hope I'm not challenging you too much on this. I'm afraid I'm technologically partially challenged. If you're able to...
Oh, at the bottom, can you see where it says share screen? If you just hit that, your slides should come up if you've got them on your computer.
Yeah, there's some technical reasons why from the hospital I can't do it. So if
you want to, can you email them to Jackson real quick, and we can go to if you send them to Jackson, Jackson can put them up for you.
Okay, that's all right. You know what? Let me just talk through it, just because I think in the interest of time. Okay. So I think what's interesting here, from my standpoint, as Janet mentioned, I'm a pulmonologist. You know, we've been thinking about climate change. Certainly I have. I don't want to project onto others as a slow-moving, but definitely a problem that's going to happen. You know, it's moving towards a situation where increasingly we're going to be recognizing that we have a problem that we can't get out of, and it's better to act now so that we can mitigate the severity of the disaster that is coming. And I think all of us have recognized through some of the presentations we've already seen today that it's very clear that humankind is having an impact on climate. Some of the pictures from various parts of the world are pretty clear, no pun intended. You know, before and after COVID, how the skies are much clearer, cleaner, you know, with less human activity. You know, we can actually see the air that we breathe in a way that we've not been able to look at the sky, I should say, the way that that we are now. In many parts of the world, you can actually tell it's a blue sky. So how is this related to what's happening with COVID? I think that some of you might be familiar that there's a very famous picture that was taken by the Apollo 8 astronauts. It was called Earthrise. And Earthrise is a beautiful picture of the Earth as it rises over the horizon from the moon, and you start to realize that all of us, you know, all 6 billion of us living today in different states, different countries, all in different parts of the world, are all living on one Earth, and that in fact we are entrusted with the health of this planet. There's only one planet like Earth anywhere that we can see here. And if anything, I wonder if there's some lessons learned from COVID that we can apply in order to make progress. And I like very much Dallas's point that we shouldn't wait until all of the attention from COVID is gone. I think the question is, how do we gear up to what almost certainly is going to be an increase in economic activity, and then the return to the way things were? How do we start to think about the urgency of now in planning and start to raise awareness about what we are doing to the planet and how should we behave differently? And to that end, I want to call your attention to some work that Steve Wine, who I think is on the webinar today, and I and Robin Wilson and some others across the university system have been thinking about the healthcare workforce and how it's been impacted by COVID-19 and how that portends, what is the future and how do we start to draw some lessons learned towards the next pandemic, towards the next disaster. Many of you know that through the emergency management cycle, there are several phases of response that we all go through when there's a disaster, including the pandemic. We are currently in what's called the response phase of that pandemic, where we're addressing the urgent needs of what's happening. Business and operations are not functioning normally. We're moving into a response phase where we're realigning all of our resources to address the crisis. At some point, most of us believe that the pandemic from COVID-19 will ease, we will find new treatments, we will find a vaccine, all of that eventually will come online. There'll be enough herd immunity among those of us who have already been infected that eventually the brute force, some of the adverse consequences we're seeing will start to move away, and we'll move into a recovery phase where we start moving towards regular operations and activities. And to Dallas's point, I think what we want to do is to think about how do we organize ourselves now so that as we move into the recovery phase, thank you. If you want to go to the next slide. Thank you. So this is the Earthrise. So all of you are quite, I think, aware of this picture. And some people have said, actually, this is the most influential environmental photograph ever taken. And that's because it demonstrates we're all one, and no matter where we live on one Earth. Next slide. And I think what we really are now is in the, oh, you want to go back one, sorry. What you really want to notice is that we're kind of all consumed right now by COVID, but there is an underlying climate change phenomenon that we don't want to take our eye off the ball. Next slide. So what I was talking about is this report here that really Steve Wine deserves the credit. He's been doing a masterful job of leading a number of individuals across all of the University of Illinois, the entire system, so to speak, in supporting the healthcare workforce and helping us understand the effect of COVID on our workforce. Next slide. And as I was just walking us through, there are several phases here, and some of these really relate to the conversation we're having now, and I think we should be preparing for this. While we're mostly in the response phase of addressing the COVID crisis, we will eventually, in the next some number of months, we're thinking sometime in July or August or sometime by the end of the year, start moving into the recovery phase. It's likely to be more protracted because we think that the COVID-19 effects, there'll be multiple ebbs and flows of this. We think as influenza season starts, the regular influenza season, it'll start complicating matters. So I suspect it won't be as nice, linear, smooth process from response to recovery. There'll be several back and forth between these two phases, but eventually most of us believe this will get better. And we'll eventually move on to mitigation, where we're trying to figure out how to prevent or reduce the consequences of what just happened. And then finally to preparedness. So there are two lessons learned here for climate change that I think we should take advantage of. One is that we are working together as a planet at this point, all across the world, healthcare providers, industry makers, some elements of our government are actually working in a coordinated fashion to address the response related to COVID. What are some lessons learned that we could draw on to think about climate change and what we could be doing in a more coordinated fashion to respond to it? Next, as we move into the recovery phase of COVID, I suspect that most people will be thinking about bringing the economy back online. And to Dallas's point, we wanted to think about how do we make sure that the climate change agenda is front and center as we move into the recovery phases here. And then we move on to the mitigation preparedness phase. Again, how do we start to prepare ourselves for climate change related activities that are likely to become increasingly a problem? I want to end by saying that this particular timeline or response to recovery to mitigation and preparedness, again, want to thank Steve Wine for helping us think about it this way, lays out the timeline for COVID-19, but we've also recognized that all of these phases, they have certain needs and certain impacts on the people, the information, the processes, the space, the equipment, technology, and also the human component of delivering care, either the physical or psychosocial aspects. And I think some of this framework is very relevant as we think about climate change. In closing, I will say that the COVID-19 response has pulled together actors and individuals all throughout the world to work in a more coordinated fashion. I certainly believe that healthcare practitioners are learning from each other, not only across the US, but across the world. And I think it serves as a model for how we could potentially accelerate and work in a more coordinated fashion in order to protect the earth that we live on. Thank you so much for your time.
Oh, doctor, that was so wonderful. That was so perfect. We folks still have two additional really wonderful panelists to add to our conversation. So we appreciate that you're holding on, and then if you still want to hold on further, we'll do some more discussion and incorporate some of your questions. The next speaker is Jose Bravo, and again, I refer you to our website for more detailed bios. Jose is with the Just Transition Alliance. He was also at the People of Color Summit, first People of Color Summit and the second People of Color Summit, and is based out of San Diego, but does a lot of national and international work around climate justice and around the just transition, including aspects of the regenerative economy. So, and then after Jose speaks, we have then to bring up the rear, we have Michelle Roberts. And so please hold on for Michelle. She's an awesome speaker. She does a lot of spoken word work, and we're really excited to hear Michelle as well. So Jose, let me turn it over to you.
So while folks were talking, it was raising a lot of different ideas and flags actually in my head. You know, one of the things that we saw after Hurricane Katrina, Hurricane Maria, and others was this thing called disaster capitalism. So we're seeing disaster capitalism with COVID-19 as well. We're seeing that things are hard to buy, hard to get a hold of. We're also seeing that testing for COVID-19 is becoming difficult in communities of color. It's primarily much easier in white communities than it is in communities of color. And we're also another thing that kind of propped up for me an idea was this piece that Juliana and other folks are talking about in regards to these industries that are still causing harm, even with infrastructure that's no longer in use by imploding that smokestack and stuff. And I remember that a lot of the conversations in our communities have been that these industries are there in order for us to have jobs. I call that economic extortion. I call that economic blackmail, because we should move, and we should have moved years back towards supplying jobs that don't put people's health, workers' health at risk, or those communities that these industries are at risk. So when we talk about pandemic, you know, we're talking about natural pandemic, we're talking about unnatural pandemic with the removal of a lot of green space, green areas, forested areas and such. But we've had in our communities for 528 years, we've had pandemics, except the fact is that some of them were brought to us, smallpox. Others were part of the natural order of things. But let's focus on the ones that were brought to us. I think that when we see that more than just people of color and communities, and indigenous communities being affected, it's then called a pandemic. It's now something that we should all take an issue with. What has happened to the pandemics of lead contamination in our communities, where learning disabilities is almost a norm in Latino and African American communities, where cancer rates, diabetes, and asthma is something that every one of us know somebody that has that. These are our pandemics. These are the pandemics that have been happening in our communities. It is now the thing is that now white, middle, and upper class white people are being impacted by this COVID-19, that it becomes an urgent thing. but we've been going through it for 528 years, to be exact. And then I think that having to look at, you know, as Dallas was talking about Navajo, the Navajo Nation, how it's impacted, it's not even making the news. What's making the news right now is some jerks at a state capitol that are all weaponized and trying to get in. But what happens in our communities usually goes unheard. I think that even the data that comes out, and even some of the data that was spoken to, doesn't single out communities that are over impacted by industrial use, by heat sinks, by a bunch of other factors that cause harm and causes our health to be in decline. What happens as a result is, if we don't start talking about some of these issues, history has always proved to us that it becomes a lifestyle issue. People are getting sick in communities of color because of their lifestyle, because they don't want to wear a mask, that they don't want to do this, they don't want to do that, they don't want to protect themselves, they eat pork, they smoke, they drink. That's been the common denominator when people talk about our health in our communities. It isn't that we had 90,000 parts of xylene in the water in Matamoros and on the Mexico-US border. It's the fact that we're really bad. So for us, I think it's high time that we start thinking about the solutions. But, you know, people are talking about climate justice, and the solution being renewable energy. When we talk about renewable energy, you need batteries. And when you need batteries, communities like Juliana's are looked at to recycle those batteries. And is that another pandemic in the making? Is that the foreseeable disaster that we'll be talking about next? Or are we going to start using things that don't poison us, that contribute to our communities, local economies that are grown locally, that are manufactured locally, not only with unionized labor, but with labor cooperatives? I think we got to be careful what we ask for. And one of the things that always arises, how are we going to pay for the infrastructure that's needed to be created in order for us to keep this momentum of lowering carbon emissions during this pandemic and beyond? I think it's high time that we go after the subsidies that all these corporations get. That's our money. I think we go after the subsidies and we start building that infrastructure. If we don't do that, the banks aren't going to loan us that money. Government's not going to loan us that money. So I think that we need to take back our money, which is locked up in these subsidies that these multi-billion multinational corporations get to create that infrastructure. Lastly, I want to mention that farm workers, you know, my parents were farm workers out here in California, and farm workers are impacted, and everybody talks about, you know, how farm workers are essential workers. Like somebody said, they've been essential workers since farming started. But the fact is that most of them don't even qualify for programs to get any kind of assistance. Most of them do not go to the doctor like many people do. And ultimately, with the rise coming up in heat in the summer months, we're going to see more heat illness, more people getting infected because of the ways that farming is done and farm workers are treated. So let's really focus and make sure that we understand where we have to deal with these situations. I've always said that in environmental justice communities, if you deliver an environmental justice community from being impacted by toxics and waste and redlining and everything else that goes along with it, society as a whole benefits. So let's focus where the need is real. Thank you.
Thank you, Jose, from the Just Transition Alliance. And now we turn to Michelle Roberts. Michelle also is an environmental justice activist. I'm loving this conversation on climate justice meets global health and so many dimensions of this intersection and of this conversation. Michelle, not only, as I mentioned earlier, does a lot of work in the area of the spoken word, but she is with the Environmental Justice and Health Alliance for Chemical Policy Reform. So it's a great follow-up to what Jose had to say. So let me turn it to you now, Michelle. You're on mute, so just if you can turn your mute, there you go.
Unmute myself.
There
Hi,
you go.
everyone, and thank you so very much. It's a pleasure and an honor to be with all the family. Hi, Auntie Pam. Hi, Pam. Hi, Jose. It's so good to see you all. And I'm so grateful to follow up and be part of this esteemed panel. You know, as I listen to each and every presentation intently, it brings us to a point that I want to come back around to, and that is this Anthropocene. I want to actually begin with the end and end with the beginning. Anthropocene, how do we even go up against that? As Juliana says, there's only one word: love. It's very simple. It's called love. And that love is what binds us and makes builds our humanity. That love is our connectedness to humanity. That love is our interconnectedness to Mother Earth. We learn from our brothers and sisters, our indigenous brothers and sisters, that the earth can deeply repair herself, as we're seeing from the examples as we speak with respect to this pandemic. For in the family, and as we speak about legacy, Environmental Justice Health Alliance for Chemical Policy Reform, that is a long word for legacy fence line, frontline community organizations and groups, and the environmental justice advocacy groups that actually serve and provide capacity support to these legacy organizations and communities. We say legacy because legacy extends beyond that of legacy pollution. It extends back to that of legacy historic racism, that of going back to the forced migration and extinction of our Native Indigenous brothers and sisters, and even to that of my dearly beloved family, those of our slaves, the slaves who were brought and ripped from their own land and now are left as landless people, then legislated into this society, never really looking at and addressing that of the health and trauma conditions that really impacted them from the very beginning of entering the shores of the Americas, and then coming to someone like my Uncle David, who was all of 15 years old on this picture, and pushing back just slightly to something Jose said about pandemic during the TB crisis, when he was subjected to being in a separate but unequal shack to die. My grandfather put him in a car and drove him back to Indiana, Terre Haute, Indiana, where my grandmother said I would nurse him and help bring him back, because we can't have this happen, after they drove all the way to Delaware. Meanwhile, in the same year, 1952, my grandmother, Pauline Dickerson, my maternal grandmother, had a cancer, but equally lived on an AJ, what we call the Route 9 industrial corridor, but in addition to that had TB, was subjected to a separate but unequal shack to die. The very same shack that my Uncle David, that my grandparents refused, no, we're not gonna have him go there. But unfortunately, my single parent grandmother had nowhere else to go but there, right? This is not just my story. This is the many stories of the communities that we serve in the Environmental Justice Health Alliance for Chemical Policy Reform. So there is a huge disconnect between that of public health and environment, but equally that of public health and communities of color, because as we fast forward into today and provide the capacity support that we have had with data after data after data, who's in danger, life at the fence line, watered down justice, environmental justice in Delaware, all of these things equally day late and a dollar short, what discount dollar stores do to your communities, equally having solutions to these bodies of pieces. You think of wonderful bodies of pieces, right? We're in this intellectual space here, that of the University of Illinois at Chicago. Wonderful, we have solutions coming from the grassroots, but yet all states and public health DEPs are not created equal. We still hear it's too much of those molded tortillas you eat. If you would only stop eating those chitlins and stop drinking too much liquor, and if you stop smoking too much, you wouldn't be, having these cancers and all of these things at these disparate levels. And now we have come into Katrina, as you said, Jose said. And that's the time that we said that, we pulled the cover off of racism with public health and the likes thereof, and we're gonna do better. But did we do better? We're at this pandemic, and that cover that we pulled off sadly went right back on, and we still have disconnects between not just the chemical industrial uses, but equally that of public health and the response, the access, the fact that we don't have access to adequate health deliverable systems, the fact that we don't have access to that of, as you heard, that of the treatments, but equally that when the treatments are done away with, where are those viral kits going to be disposed of? How will they be disposed of? And then as we move forward, talking about how it is that we have these COVID task force and all these other things, those things that come after the fact, how do we really move forward to really reopen in a space that really provides radical health and wholeness to all, not just the select few, to all. And then as we move forward and looking at the industries that are already in existence, understanding, yes, we do want to do away with the fossil fuel industry and these harms that are harming our communities such as they are, but as they are in existence, what does it look like inside of these facilities as it relates to that of the sheltering in place, social distancing? Does the output still equal the same as we look at how these facilities should be retooled? And by the way, we have rolled back the modest gains of the policies that we've made to be able to get them to a point of protection. And as we speak to labor, have we addressed the racism inside of labor? Are we really looking at these particular things? And on and on and on. The story continues to go on, but as we say, we cannot go back to what we were. We are at a point where we could possibly get it right. The good news is that with EJHA and some of the things we have done in seeking to move forward with respect to our solutions, we have gone back to some of the folks that have been failed to us and that of policies that have failed us, such as the Toxic Substance Control Act. We are actually at tables in collectives, right, wrong, or indifferent, what others may think, but we're sitting down with some national groups actually going through some of these policies that have created harm to our communities and said, you know what, this has got to stop. So there's many layers and levels of ways in which we must address radical justice. We are no longer in the space, friends, to talk about equity. That's over. That was pre-pandemic COVID-19. We now must be clear. The conversations must be rooted in justice, that must be aligned. We must address the sins of the past and be able to move forward in harmony and last in love. Because if we don't have love there, as Dr. King said, we will go, you know, if we just don't have this love, this is what's showing us in these 500 years. We must have love in it all. And that's what Mother Earth is trying to explain to us. And if we could only just lay down our egos and our intellects and just open our hearts wide and just, because we'll be able to hug one another soon. But right now we got to let our hearts be able to be the driving force for us to be able to bring our humanity totally together. That's why we had the social distance, perhaps, in order for us to understand how much we really do need one another. I love each and every one of you. Let's really do this thing aligned in love, and let's not leave no one behind this time. Not no one. God bless you.
Yeah. Fantastic. Wow. I'm going to ask a panelist who may want to respond to something one of the other panelists have said. And Jonathan, you spoke first. I don't know if you want to respond to anything you've heard. And as people are thinking about what they might want to say, I want to make sure that I take note of the fact that this was generously supported by the Sawyer Seminar Fund of the Andrew W. Mellon Foundation, as well as the Warren Levy Family Charitable Fund. I also want to let people know that we will be posting this video at some point on our website, and it will also be shown by CAN TV, our local public access. So we'll let everyone know when that happens. I also hope that people have been checking out the comments on the chat screen. There have been a lot of really great comments and a couple of questions. But let me first turn to, as we start moving towards thinking about wrapping up, though, I want to give the other panelists a chance to react to one another. So Jonathan, I don't know, you started this thing out. Is there anything you want to say?
Yeah, well, I think it's been a fabulous panel, really some great ideas. So I'll start the questioning. I'll just ask panelists, Rachel talked about hanging on to public trust at this time when finally people recognize there is some value of science and there is some value in listening to experts. What are some best, some creative ways to really do this, to really next steps to taking advantage of this moment to hang on to the public trust, to push forward science, ethics, equity, environmental stewardship, and in this moment, where do we take this?
Thanks, Jonathan. In the very active chat during all of the presentations, and thank you everyone for the presentations and the learning opportunity and the camaraderie, and Michelle, the love. Thanks for that, everyone. I was struck by a comment that Jose posted Oil and gas, public subsidy, $68 billion a year. Industrial agriculture, $100 billion a year. I think in terms of that outward communication and this resolution that I think everyone's come to today from different perspectives to not go back, right? We've got a local public intellectual in town who's doing a book series, Never Normal Again, right? Because it's not as if the world before this was working for most people. So, I mean, in brief, and I want to loop Dallas into this too for some more specific tactics, but $168 billion a year we pay for our own demise, for our own suffering and our own poisoning. And obviously, you know, there's no such thing as like Americans, right? There's no broad category like that. There's people, you know, in different regions, different backgrounds, probably the most tangible these days, different political persuasions. But I don't think that people like to be had. And, you know, we are with differential experiences, certainly, and differential privileges, like we're being had to pay for these things to enrich the grossly wealthy, you know, to live in a dangerous, cruel world where we really need the love evoked by Michelle, you know, just to make it through and to remember that key humanity. So I think at this moment, you know, exactly when there's celebrations of medical professionals, essential workers, although, you know, still with the exploitation that Pamela brought up, I think that's almost the way to go. Like, you know, kind of celebrate the people that work, that struggle, that care, and really expose that. And at the same time, reclaim it. Like we are a public. You know, even if we're in behind our own doors right now, like we're a public, and like, let's reclaim what's ours for us, whether that's our money, our values, our water, our love. Like we need to bring it back in that beautiful way while never hesitating to kind of expose exploitation and this really, really cruel late capital for what it is. So that would be my, you know, kind of rhetorical approach to it.
Dallas, did you want to comment?
Yeah, I feel like it's the challenges. There's a lot we don't know, right? This is something that this moment is no one has ever experienced something to this degree, right? This is a worldwide event that is not a single person on this planet has been through this. And so, you know, we do have ideas and thoughts in frontline communities across the globe have all more or less have been in crises for generations who have developed tactics and strategies to get through that. So there's a key aspect of that, of like, not only are frontline communities, you know, impacted first and strongest by the effects of climate change as well as pandemics, but you also find a lot of the solutions in those very same communities. And so when we talk about, you know, just transition or recovery, or we get into mitigation, I think it's absolutely essential that we look to those communities who have had no one else to depend on. They couldn't depend on the federal government. They had to depend on themselves to come up with ways to mitigate the issues. And so I think that's going to be a critical voice as we move forward. Is, of course, there's going to be a whole national conversation about the economy, where there's ongoing conversations about nationalizing the fossil fuel industry itself. But we also cannot overlook how we elevate local communities as they look to you know, build from within. And, you know, prioritizing those localized economies is absolutely essential in that effort. So that's my only part I could say for now on it.
Well, that's awesome. I want to go to a question just to incorporate into this conversation as panelists are continuing to respond to one another. This is from Rosa Cabrera, who is the director here at UIC of the Rafael Centron Latino Cultural Center. She's also been teaching a course and will teach a course in the fall on environmental justice and climate change. She's asking, I think, an important question that gets at this conversation about solutions and so on. How do we make that cultural shift that asks for what is good for society versus what is good for the economy? And it seems like that you know, that sort of underlies you know, why we give $1 billion and billions of dollars of subsidies, because somehow we have defined that as being good for society because it's good for the economy, but is it really good for society? And I think, as you all pointed out, you know, the prices that we pay for are not being are very high. And so, how do we make that cultural shift? Is anybody wants to address that? Go ahead.
I'd like to start off with just like, I could totally see the scenario in a couple of months as states start, you know, relaxing their quarantine measures, of a big push of saying, everyone's got to go shop. Like, you got to get back to, everyone start buying clothes. We need people to go to the mall, go back, make this country great again. I could totally see the narrative of strong push to return the economies back to the status quo. Wow, I think a lot of folks are realizing that that their shopping practices have shifted to what is really needed, and they've kind of had let go of the stuff that isn't as vital, you know, to be going to the mall 3 times a week, if not more. So I think it's a really great question of how do we encourage us to continue to think about what is most important to our communities and for our families. Because I would not be surprised that we would see a big push to get people to they would package it as like support small businesses, go out and start buying clothes and start buying, you know, all these goods, and we need to build do your part kind of approach. And that's a genuine concern of mine.
We need to have some counter narratives to that we put out there as well, right, to our communities. You know, and one of the things.
Well,
go ahead.
Yeah, Teresa, I could try. You know, so as Jonathan said, it's not a trade-off between climate and the economy. You know, that climate actions can spur economic growth and bring about lower costs for energy. You know, in the same way, it's not a trade-off between justice for disadvantaged communities and climate actions. And I think, you know, the state's Future Energy Jobs Act, you know, did a nice job in putting aside $30 million in job training for disadvantaged communities, people who are coming out of prisons and such, in order to create a workforce of solar panel installers who can help us build out clean energy systems in the state. In the same way, cities and states that put aside money for energy efficiency projects at low-income housing, you know, save the tenants money and the owners of you know, money, create healthier living environments, and create jobs, you know, while, you know, cutting down on greenhouse gas emissions. So these programs, you know, take attention, and it's too easy to adopt something that ignores the needs of disadvantaged groups. But on the other hand, it's not a trade-off. We can do them all.
No, I think that's really great. And I was going to say something, but I'll come back to what I was going to say, and instead refer to something that somebody raised this issue of, as we're trying to do it all, for example, and as we're trying to reverse climate change, how do we deal with more recycling? How do we deal with energy storage technologies? One of the questions I had was also related to batteries, for example. Some of that which is needed for batteries, for example, comes from Venezuela, and there's some thought that that's not unrelated to some of the geopolitics as it relates to Venezuela, as we were looking for that lithium. So that question about how do, you know, as we're thinking about it, it's not doesn't have to be a trade-off. It doesn't have to be one versus the other. How do we do both? I think some of those ideas are in the restorative economy, as somebody I think mentioned. I think that might have been you, Dallas. But how do we do what Warren is suggesting? How do we do this in a way that doesn't? We're not saying it has to be one or the other. How do we? And I guess it is partly in how do we create a different kind of economy, where the question always is who pays, who benefits, is something that I think that is part of thinking that through. And Jose, were you going to say something? Go ahead.
Yeah, I was going to mention that, I think that we have to look at regional and local economies to scale. If we don't see that, if we don't do that, then we are going to shift the burden somewhere else. I'll give you a case example when, this craze around weatherizing homes, and I use this example. This craze around weatherizing homes to make them more, able to stay cool or hot, whichever way you want to do it, the thermal factor. So the way it was done, it was vinyl windows. And everybody jumped on that craze and it was, oh yeah. But who didn't get the vinyl windows first is those communities that were supplying the vinyl, the chemicals, everything that goes into vinyl. Those communities that were supplying where those chemicals are coming from were the last ones, or probably still don't even have these things. So we need to look at economies to scale. A lot of these products, like windows, can be made from hemp products instead of using plastic. So if we don't also start thinking about future, about how things are made and what the impact is at the point of extraction of whatever we're gonna make, which is usually in indigenous lands. If we don't look at that whole evolution from cradle to cradle, from the point of extraction to where those chemicals are produced, where those chemicals are put into those products, where those workers are working with those chemicals, where those chemicals go out into retail stores or sold, and how those or those windows are transported, and then how those windows ultimately are not recycled in a way that's adequate, because they're sent to our communities to be taken apart and then other products made. That for us is a non-starter. If we don't start looking at the life cycle of products from cradle to cradle, then I don't care who wants to make this world better, it's gonna make something worse for those communities.
Important to keep that in mind. And I want to correct something I said. It wasn't Venezuela, it was Bolivia that I was that I was thinking about. There's a couple of questions I want to go to, but first I want to make sure that Juliana gets in on this, because Warren, you mentioned earlier about the state energy Jobs Act, right? Juliana, you'll correct it for me. But that was something actually that Juliana was part of the group that worked on that. And I don't know if there's anything that you want to add to that, Juliana?
Certainly. Thank you for calling on me again. I'm sorry that I had to step away for a few minutes. So the Clean Energy Jobs Act, I think, is interesting in a few different ways. One, it's really broad ranging in scope. We're addressing the energy industry, we're addressing transportation, we're trying to do decarbonization, and we're also trying to use an equity and justice lens across the different programs. So that looks like who's getting the money, where is it coming from, how is it, how are state incentives balanced against economic justice for people who can't pay their bills, right? I think some of these more macro questions that in policy, there are these trade-offs, but the people deciding about those trade-offs are generally not communities. They're policymakers that are acting either as an appointed or elected official. Sometimes they're getting input from frontline leaders, but that input is at the very end of their process. And in this case, communities themselves deliberated about what trade-offs would best serve the communities in Illinois. And I think the important thing to know about that is, you know, there is a lot of resistance at first to do participatory policymaking in this way. And I would say, you know, the energy industry in particular is decades behind in terms of how they think about policy. You know, we're dealing with some like archaic ways of thinking about decision making, and the decision makers themselves are also largely older white men. There's just all sorts of dynamics about who gets invited to the table. And generally the regulated entities in Illinois had the upper hand in terms of setting the table, setting a frame, and then trade-offs were discussed sort of in light of that. In this case, communities came together through a participatory process, and we had community meetings around the entire state, over 100 of them, and folks gave direct input into what are the problems that they're facing, what kinds of trade-offs are they comfortable with, what kinds of economic and social realities are they dealing with, and how should programs be derived from that. So the starting point was really different. And I think, you know, we ended up at a place where not everybody's getting everything that they want in a big package that balances all these things against each other, but it's a lot closer to the reality that we want to see, I think, than anything that we've ever attempted in the past across this many different communities. And, you know, I think moving from a place of principle and alignment and governance where the community members themselves are the ones saying, no, we can't, you know, fail to address you know, the transportation sector because look at all these impacts that we're seeing in our communities. No, we can't just talk about passenger vehicles, you know, single occupancy cars. We have to be talking about semi trucks because those are the vehicles that we're really seeing the impacts from. You know, no, we can't leave out the life cycle of solar panels. We need to be discussing what kind of programs the state needs to have if we're going to be incentivizing the creation of something new. We have to think about all the consequences that are associated with that thing. So I think, you know, the discourse that comes from that kind of policymaking introduces many, many more issues, and that makes it harder, but that also means that we're actually getting to some of the kinds of transformation that we need to see. And yeah, I think, you know, this legislative session, totally unprecedented with COVID. The things that I think I'm urging, we still think we need CEJA, we need that kind of transformation in our energy and transportation industries, but we also need to be thinking about, okay, what are some of the parts of what we're trying to address that really need urgent response? Things like economic justice for folks who can't keep their heat and lights on. Things like making sure that people are able to stay in their homes. How can we reduce their costs? You know, how do we make sure that small Black and brown companies that we're trying to get up and running and hiring folks who were formerly incarcerated that came out of our training programs, how do those folks still keep their jobs? And do so safely. So it's like that kind of stuff that's really coming to the fore, but that's all already incorporated in CEJA, and it's more about how do we support communities to make the transformative asks that they need to make right now about work conditions, about economic justice, about environmental safety that need to happen, and how can those communities be centered as decision makers in a policy as opposed to a policy being driven by institutions who have their own goals for what the outcomes would look like.
Yeah, great, thank you. Any of you want to comment on that? I do have a question that is directed at you, Dr. Patz, about tire and brake wear as another significant source of PM 2.5, particularly near highways where housing is cheap. If renewable energy is cheaper, then transportation will be cheaper, and we are at risk switching from one pollution source to another. What solutions do we have for that? Any thoughts on that?
Well, you know, brake linings and tires, these are forms of particulates, but I think, you know, the overwhelming the overwhelming contribution is from burning fossil fuels, and especially diesel trucks in transportation. That's the worst globally. So these are, you know, if we were to shift to electric vehicles, and I agree with the panelists who say we absolutely need a full life cycle assessment of anything we do, that we need to be looking at the trade-offs and whatever they do. I remember a study that asked the question, is it better to drive a hybrid vehicle or an electric vehicle or a gasoline vehicle? And this is from a few years back, maybe 10 years ago actually. And if you're in California and enough of your electricity comes from renewable energy, makes sense to drive an electric car, full life cycle assessment. But if you are in the Midwest and a lot of, and if you looked at ethanol, like corn-based ethanol as a power source, you know, the effort, the fuel that goes into growing the corn and all that pollution, you know, you have to look at a full life cycle assessment. It turned out that burning a gallon of ethanol, which immediately would seem cleaner if you looked at the total life cycle assessment, it would be dirtier. That's changed though, because there's enough switchover now that the electric vehicles are becoming, you know, life cycle assessment are becoming economically more feasible, life cycle assessment less polluting. And I do worry about, you know, disposing batteries. And as Jose pointed out, you know, there are going to be trade-offs, and you can't think that there's going to be a silver bullet and all of a sudden we don't have to worry about anything. But we do need to take this very broad view, full life cycle assessment. But things are changing, and battery technology is getting much better. The price of renewables is, as I mentioned, dropping through the floor. Surprisingly, a colleague of mine, Greg Nemeth, wrote a book on why solar became so cheap, because yeah, it's been dropping, but it's been surprisingly dropping the price of renewables. So I think it's time to rethink these options. But you know, back to the question, you know, most of the air pollution is coming from burning fossil fuels. These other things we do need to keep in mind, but let's go to where the big contributors are and solve those problems with a full life cycle assessment approach, so we don't have unintended consequences.
And without the subsidies, right? Which is part of what's keeping them going.
Yeah, I just want to repeat a comment that I made towards the end about this is you know, pre-COVID, because the price of oil dropped below zero, right? So this is pre-COVID, that literally the cheapest way to generate electricity for the first time in our history is by renewables with batteries. Published in 2018, I think, 2018 or 2019, was a report of the International Renewable Energy Agency. Post-COVID though, and the price of oil, I mean, this is a time to get out of oil investments, number one. So if anyone's investing in energy, my God, get out of oil. But I do worry about the cheap price of oil. And I really worry, and this has been brought up by others, I really worry about these stimulus packages going to the wrong places, to just propping up the old conventional dirty energy sources and not being proactive. So this funding, these funding packages, these stimulus packages, to me, you know, that much money going the wrong direction is an emergency for all of us. And we need to step forward and make sure, as some of the panelists have said, to really, you know, build the future we want, not the one we had.
Build a future we want, not the one we had. And with that, I'm going to ask each of you in maybe 1 or 2 sentences to say something about this conversation between climate justice and global health, with a particular emphasis on a solution and on building the future on what we want and not on what we had. Michelle, let me go to you first. 1 or 2 sentences.
Yes, thank you so very much. First of all, again, we must really address racism, the systemic issues and impacts of racism. And we would be remiss if we, as the Environmental Justice Health Alliance for Chemical Policy Reform, as we say, there are safer chemicals and processes that we can indeed address, embrace and utilize to take a more precautionary approach to the way in which we do our, go about our industrial lives, if you will, so to speak. In addition to that, we must equally embrace that of public health and environment. It is interconnected. Public health, environment, and economic justice are all interconnected. At the very end, environmental justice is climate justice, and climate justice is environmental justice. When we do this in love, we rid racism. Thank you very much.
Thank you so much, Michelle. Jerry had to go back to his clinical work. I think you're gone, Jerry. If I'm wrong, you'll step in here. Jose, let me go to you for a couple of sentences to wrap up on this conversation between climate justice and global health.
So I think right now is the perfect opportunity, since a lot of these corporations are going to be asking for bailout money. We know that, to force accountability. So if the car manufacturers are going to be asking for bailout money, we should make sure that 80% of what they produce is non-polluting emission-wise. So mass transit and those kinds of things. I think that's a goal we should all strive for.
Thank you. Great. Let me go next to Dallas.
I first want to say thank you for hosting this, and to all the folks, participants, and people watching. I think Michelle and Jose have said the things that I needed to say, you know, like the steps that we need to take too, and always seeing the bigger scope of how this is all connected. It's absolutely essential that as we talk about, you know, revitalizing an economy or economies, that we have to think about the greater impacts on communities of color, impacted communities. So that's all I have to say. Thank you so much for this moment.
Warren.
Sure. So the healthcare professionals are clearly in the front lines of treatment now. And, you know, thank you for everything that people like Jerry and Janet and others are doing. But I tell law students that lawyers are also frontline workers, you know, when it comes to COVID-19 and when it also comes to climate change. That if we don't get the laws right on wildlife and natural areas that are protected, we're going to have more spillover. If we don't get the laws right on occupational health, on insurance, on, you know, these programs for economic recovery, you know, we're going to have more, not only environmental disasters, but also inequity. So, you know, to the extent that there are, you know, any students on the phone still, or, you know, on the call, you know, please help us get the right policies in place. Let's, you know, make sure that lawyers and all professionals understand the risks of these communicable diseases, the risks of climate change, and what we all need to do to make them better.
Really appreciate you reminding us the legal aspect of this, or at least emphasizing it again as we round out here, because so many of them are under attack right now. So many of these laws and regulations that movements helped create 30, 40 years ago. And I think you're absolutely right that this really is an important arena for our work. Let me see here. So Janet did have to also step off. She sends her saludos or her goodbyes, and then Pam also had to step off. So that leaves then Juliana and Jonathan. Oh no, I'm sorry, Rachel. Let me go to Rachel, and then I'll go to Juliana, and then I'll end with Jonathan.
Okay, so just to build on what Jose said about the full life cycle, I would say there is no away for wastes. The wealthy and so many white communities have benefited from the offshoring of waste to the global south or to communities of color within North American boundaries. And whether it is combined sewer overflow or the fact that no one wants our so-called recycling to be shipped on a barge, there's nowhere to offshore these things. And so that means that if there's nowhere to put it, if we live with everything that is produced, then we have to have a say in what gets produced, in who is paid to produce it, and that this way of like no more waste, there's nowhere to send it, and it is an illegitimate category. And Teresa, you know this is my great dream, but from what we now call in Cook County in Chicago, we call it our wastewater. And we spend billions pumping it to the Gulf of Mexico, to a dead zone the size of New Jersey and growing. Like, this is water, people. This is not waste. So that's like the number one for those of us in Chicago. That's like a key intervention in this whole thing to reclaim value out of something, that extractive capitalism for 100 years has called waste.
Thank you. Juliana.
Hey, thank you everyone for this important conversation today. I think the other speakers have said a lot of the things I was thinking. I think a couple of other things that came up for me include really keep your senses sharp. Beware of false dichotomies. I think in this time when folks are raising solutions, when there's when there's crisis moment, Jose was absolutely right to raise this as an opportunity for disaster capitalists to force people into false choices. And I think, the sharper we all are about the things that do not need to exist in opposition to each other and should work together to serve the folks who are the most impacted as decision makers, as beneficiaries, to limit the external consequences, we must do that. I think that as much as there is a project of racial capitalism to extract from communities and oppress them, there's also a campaign to deliberately confuse people, to make people feel like they have no choices, and to use that kind of coercion to put people into desperate economic and survival circumstances that just aren't tenable. So I think beware of those false dichotomies and try and stay as sharp as possible about the kinds of decisions that are being imposed as a framework, when that framework itself is actually intentional and destructive. I think we're seeing that left and right, and these are exactly, as Jose said, the moments when that is most used as a tool to really undermine community well-being and perpetuate the project of racial capitalism. So I think that's the thing that really is sticking for me. And circling back to what I said at the beginning, what Dallas re-emphasized, remember, the long history of settler colonialism. It's still an active project. How are the ways that we ourselves are directly impacted by that? I think it's a different answer for Indigenous people, but everyone is impacted by that. And I think being aware of land-based practices, in particular in the ways that land-based practices have been used as a mode of resistance, and how the control of land and the things associated with land and water have been a big part of this for communities for centuries, I think is really important to contextualize the moment that we're in and to understand the systems that we're trying to dismantle. So it's related to the first point, but definitely always keep in mind settler colonialism as an active process and land resistance strategies that Indigenous people have used across the world for generations and generations, being core to how to address that directly is just so important.
Thank you, so important. And Jonathan, our fantastic keynote who kicked us off, you want to give now the sort of the wrap-up message here?
Well, due to the hour, I won't give a wrap-up message. I'll keep it very short, though, and just say that this pandemic completely reminds us of the interdependence between the natural world and society, and that any solution that we have to get out of this, or to as everyone knows about taking a crisis and turning it into an opportunity, it is a perfect time for big opportunities, but if these solutions are not fair or just, they're not going to work and they're not going to last. So we need, you know, that type of, you know, brilliant, encompassing strategic solutions, solution generation that really embraces the interdependence. And you know, you can't have a healthy population on a sick planet, but without just and fair practices, that just can't be sustainable.
Thank you. Thank you, first of all, to all of the participants, particularly the ones who hung in here the longest. As I mentioned earlier, this will be broadcast on our local public access TV, and we also will have it available on YouTube and posted on our website. We'll let you know when that happens. Each and every one of you made such major contributions to this very, very important conversation. Great Cities and the Center for Global Health, thank you so much for your time. Our first instincts were that this was going to be a 3-hour conversation, which actually went quickly, I thought. So many issues, so many important things to cover. And I feel like we really did cover a lot of ground today. So we'll be doing some follow-up work as well. So again, thank you everyone, and really appreciate all of you, each and every one of you. So thanks, hats off.
Thank you.
Bye, everybody. Oh, thank you, Jackson Morrissey. Oh my gosh, I wanted to thank Jackson Morrissey for his wonderful technical support. Yay, Jackson, we couldn't do this without you.
Thank you.
You're welcome.
Thank you, Jackson.
Thank you for the great conversation and discussion. It was awesome. So.
Thanks for a great panel.
Yep.
Thank you, everybody. Sure appreciate it. Jackson, thank you so much, man. This was good.
Oh.
Jose Bravo, thank you.
Bye, thanks.